www.ptsd.va.gov to learn more about EMDR and other PTSD treatment.
So I would say too, if none of you, or if there's some of you that haven't been on to the website that's posted here, ptsd.va.gov, I highly recommend it just for clinical resources. Lots of really great trauma screening tools that you can utilize, different measures that are really all research-based and endorsed by the VA and the World Health Organization. So some pretty good free resources on there as well, and some good psychoeducation about just what trauma is and what EMDR is, among some other treatment modalities that are used to treat EMDR. Like I said, I will put a link on the resource document that I'm going to make you guys that will have a link to this video, as well as 2 other videos that I like that talk about what EMDR is, because I found that these little brief videos tend to explain it to clients just a lot simpler than maybe sometimes we can do as clinicians. So I like to utilize these for that, just to help them kind of understand what EMDR is. When I get into teaching EMDR, especially as I introduce it to a client, a lot of clients now, which has been a nice change in the recent years, are starting to already be somewhat familiar with EMDR, or they've heard of EMDR from a family member or a friend who said it really worked and helped them. And I still want them to know what it is, because it is such a different treatment approach than what I think people think of doing when they come to counseling. And so I do think it's helpful to provide some information to them on what EMDR looks like. Okay, so I'm going to go back to our slides really quick. And we'll be going to lunch in about 15 minutes. Yay, for anyone who's ready for a break. Okay, so to honor the fidelity of EMDR, this is where I always like to start. This is the definition of EMDR that was developed by, again, Francine Shapiro, who's passed away in the last few years. But really, she gave us such a gift with EMDR, and has just led to paramount changes in helping people with this model. So I'm grateful to be able to share and honor her work with this. So I always start with the definition of EMDR. So EMDR, for those of you that don't know, means eye movement desensitization and reprocessing. Hence why we call it EMDR, right? What's funny is EMDR, when it first came out, was really known for the eye movement piece, right? That's kind of all what we think of when we think of EMDR, is like the eye movements. And I remember, and I told you guys this earlier, but I was like, there's no way my clients are going to come in and be like, I'm going to be like, follow my fingers, right? I kind of thought it was like hokey, but it really isn't, which is kind of what makes it amazing. So EMDR now, what we know is the research and evidence has continued to build and expand since the development of the model in the late 80s. We know that there are a variety of different other bilateral stimulation techniques, which is what the eye movements are referred to as a bilateral stimulation technique, what we call a BLS, or sometimes you might see it as BS, bilateral stimulation. But BLS is kind of what we refer to that as, or you might refer to it as dual awareness, which EMDR loves acronyms. And so sometimes you might see the DAS, which just means dual awareness or bilateral stimulation. So the eye movements ultimately were the bilateral stimulation component of this. Like I was saying, since its early formation, there's now been sufficient research and evidence that shows that eye movements are not the only thing that makes EMDR effective in terms of bilateral stimulation. that there are a variety of other bilateral stimulation techniques that are just as successful, so much so that if you were to read and reference Shapiro's eye movement desensitization and reprocessing text book, that you would see that she even references that tapping and other forms of bilateral stimulation are shown to be just as effective as eye movements. So we'll talk about those different forms of bilateral stimulation here shortly. So EMDR is an evidence-based psychotherapy that was initially rooted in treating PTSD. Successful outcomes have been well documented in the literature for EMDR treatment outside of PTSD for a variety of other psychiatric disorders, mental health problems, and somatic symptoms. The model of EMDR that Shapiro created is based on, here's another acronym, what we call the AIP, the Adaptive Information Processing System, or that adaptive resolution, that brain's natural healing. So it's based on this belief that everyone has this natural healing process that's deeply rooted into our brain has a natural way to heal itself. And the model of EMDR believes that much of psychopathology is due to maladaptive encoding or incomplete processing of traumatic or disturbing adverse life experiences. So meaning that we've stored, we've maladaptively stored, like let's say we go through the car accident, right? The example I gave when we did the analogy of the brain. And let's say the belief that we take away from that is that I'm not safe when I'm driving. And so that could be a maladaptive encoding, right? So it's the rigid thinking that occurs that gets maladaptively encoded. It's the negative perception that gets encoded with an experience that changes the way that we see ourselves, others, in the world around us. So the belief is that a lot of that psychopathology is basically due to trauma and how the trauma has been stored, to put this more simply. And when this occurs, when things are maladaptively stored, this impairs a client's ability to integrate these experiences in an adaptive manner. So they can't integrate them. They get blocked, they're stuck on them, they're always becoming hurdles, and they struggle to work past them. So EMDR, because of this, is based on what we call this 8-phase model. And we're going to be looking at the 8 phases. Phase 1 is a lot of what we covered this morning. Well, for us clinically, it would look a little bit different with clients, and we're going to talk about that, which is that history taking, kind of seeing things through that trauma lens. But it's this 8-phase model with a 3-prong approach. And the 3-prong approach means that there's a 3-prong approach that we need to hit on. So targeting the past, the present, and the future. So when something maladaptive gets stored, if we can use the 8-phase model with this 3-prong approach, hitting on the past, the present, and the future of this maladaptive encoded event, what we found is that EMDR will facilitate the resumption of normal information processing and integration. So those things that were once stuck, now we see them get naturally integrated and processed without being stuck and still being barriers. So the treatment approach to EMDR targets past experiences, and not just past experiences, the past experiences and the meaning and perception we gave those things. It also targets current triggers and finds the link between the past and the present. And it also looks at the future anticipated or future potential challenges. When this model is followed, we see that there is a decrease or an elimination of distress from the once disturbing memories, an improved view of client sense of self, which is honestly my favorite thing about EMDR. If I could tell you, that is the most beautiful thing about this modality to me, that makes it so unique and not feel so like distant and cold and therapeutic, is there is nothing more powerful to me when you get to see a client who realizes that they have all their own answers, insights, and realizations, and that I was no more of an expert than they were. When they find and come to terms with valuing themselves because that's what they found and they chose, there is nothing more empowering than that therapeutically. And that's what I see EMDR do as a whole, is improving that sense of self. We also see a relief in daily disturbances and triggers, and as well as a resolution of present kind of triggers or stressors, and not as much anxiety or angst about future anticipated events. So I know this is a lot. We're going to break it all down as we move through the day. So there's some theories on why we think EMDR is so efficient and effective. And a couple of them are rooted in these kind of three kind of theories. So because one of the main pieces that we know with EMDR relates to this idea of bilateral stimulation. Why does that work, right? Why has this been successful? Why is this an additive that's needed? Some of that theory goes back to, if we look cross cultures and cross centuries and across time, what we see is that beating and drumming has characteristically been used across cultures, time, as a way of healing and protection. We also know, as we've studied rhythm, that it's calming and a naturally healing kind of remedy. We can also liken this to the very first sensation that we experience in utero is the mother's heartbeat. And there's something about that cadence that creates a sense of healing or attunement, but probably also leads to the stimulation of the right and left hemisphere of both sides of the brain. Another theory is based in the REM cycle. And a lot of, remember how Shapiro kind of fell upon EMDR, she was studying the REM cycle and seeing at night when that eye movement occurs in the REM cycle, this is where consolidation occurs. The brain decides what it's going to hold on to, what's useful, and then it discards what's not useful. And that is also, during that REM cycle, how we tap into that natural healing process. The third theory on this, which is also one of the ones that's deeply rooted into the model of EMDR, is what we call this working memory hypothesis. What this means is it disrupts our working memory so that we can't hold on to things. So it activates both sides of the brain, but also the cerebellum, where those emotional stores come in. And this working memory hypothesis, likens the bilateral stimulation to kind of have this dual awareness approach, where what EMDR does is it forces you, the bilateral stimulation almost is causing this dual awareness, meaning it's forcing you to hold on to things that are occurring right now, but it's also keeping one foot maybe in the past, right? So it's like one foot in the present, one foot in whatever you're targeting or the trigger. And so this dual awareness approach helps keep people from dissociating and shutting down. And it's a safer, kind of gentler way to work or access some of the trauma work that we need to do. So we talked about this REM cycle in the brain and what's occurring. And ultimately, through mimicking kind of those eye movements, what we found is it's just lighting up the right and left hemisphere, forcing the brain to naturally process through things with logic and emotion. But when we do this when we're conscious, we're able to access some of that trauma store that we can't always access at night in the REM cycle and get some of those things resolved and accessed. So the framework with EMDR says that we're going to bring in this bilateral stimulation or this dual awareness component that will follow the clinical protocol that Shapiro developed. And that if we do that, what occurs is that we can activate the memory components that have been maladaptively stored as necessary for survival for those trauma reminders. And we can get the brain to let those go, see that there's no imminent continued threat. And what we see is that there's homeostasis, that the brain can get back to normal resolution by tapping into that adaptive information processing center in the brain, which is quite amazing. And I know it sounds really complex, but you're going to see it all come into play and it will kind of make more sense for us. So when we get back from lunch, we're going to be going into what the 8 phases of EMDR look like. So we covered a lot of what we're going to be looking for in phase 1. So I'm just going to summarize a couple of those things, give you some things that you're kind of screening for in this early phase. Then we're going to move into the phase that's like one of my favorites, where we're going to do some resourcing activities together, where we're teaching these early resourcing skills. We'll be going through those together. I'll be giving you a couple different skills that we'll be utilizing. And then we'll talk about what happens kind of from there in different ways that you can use those. And then we'll have a demo that we watched today. So I look forward to answering questions after lunch. And if there's anything you guys need me to clarify, please use that link like Ryan said and put those in there. And yeah, we'll go from there. But I appreciate everyone being on here. I hope so far that I've given you some useful information or at least brief refreshers. And I'm excited as we get into the next phase of this 2 days together to look at the fun parts and the components of EMDR. So have a good lunch, and I will see you guys back after your lunch break.
That'll kind of lead us to questions, round 2 of questions for Megan. And the first one, I'm even going to handle the first one. I feel
okay. Yeah, I wanted you to, but I loved that it was one that was put on there. So
yeah, I absolutely love this. I think we've all been here, especially when this started. Someone just wanted to make sure, can you see us? Can Megan and I see you? And if so, I will make my bed, which I appreciate that. That made me laugh. We can't see you. So if you're in a room where your bed is messy, go ahead, leave it messy. If you have an animal friend hanging out right next to you, nobody can see. Just get comfortable, enjoy yourselves. So now that I've done my part, I'll go on to the real questions that are EMDR related to Megan, which is, again, may get covered at some point, but a lot of people want to know about like age ranges, like who is appropriate for in terms of age.
You know, EMDR has been found to be effective for kids. There's some that would say as early as some workbooks that are specific, which I'll put a reference on for by Adler and Tapia. And I'll put a link with that reference, say as early as 18 months and on. Obviously, there's variations and very different approaches that you have to take and modifications to be made, but very good, some really good resources and some exceptional ways that you can utilize EMDR with integrating like sand tray and art therapy. So it has been shown to be effective with children and adolescents. Another good resource that I'll put a link to as well is Anna Gomez. And she's kind of well known in the EMDR realm for a really great child therapist, but it is effective for kids and adolescents.
Perfect. And next step, is EMDR a standalone therapy or does it borrow from other therapies? Kind of follow up. On average, how many sessions per trauma?
Yeah. So again, EMDR is really client-centered. And so the amount of sessions really just depends on the client, their presentation, how well they move through the phases of EMDR that we're going to see. So it's, it ranges anywhere. It could be, 3 months of sessions to maybe, months or a year of pretty continual, repetitive EMDR work. It just depends on the client. And, EMDR, I think, like any kind of modality, I guess, I think obviously there's things that it borrows from that have made it. I mean, that's how all of our modalities kind of come into fruition. We see it kind of, I guess you could see it as a standalone. To me, I integrate a lot of other modalities within EMDR, and that tends to make it, in my personal clinical opinion, all that more successful. But EMDR kind of has its own like trauma focused CBT kind of framework that you would utilize.
Which is maybe a good segment for the next question. Someone out there was wondering if EMDR and IFS play nice together. Really useful.
Okay, so EMDR and IFS, you guys, are my favorite thing to integrate together. And you can see me really nerd out about some IFS and EMDR together, because when you pair them together, I think you can do phenomenal work with some really big complex trauma issues. And it's honestly my very favorite way to utilize EMDR is in conjunction with IFS. So yes.
And here's another one I know that you deal with a lot. EMDR utilized with alcohol, substance use disorders, active use, people in recovery. This individual says they'd be kind of fearful about triggering relapse. Is it something you can use for those types of things?
Yeah, which I could talk on a lot about that fear. I'm not going to. Yes, there are specific protocols and interventions within EMDR that are specific just to addiction and impulsive and compulsive behaviors. There's some really great work that you can utilize and implement that works at targeting urges and targets like the positive associations that might be established with addictive behaviors. I think it's remarkable with addictive work. I used to have an intensive outpatient clinic, and some of the integral things that I found to really work in that realm or some of the techniques that I pulled from EMDR and some of the research around addictions. I know that we also with PESI, we just did a 2-day last week on EMDR and that addicted and compulsive kind of population. That if you're interested in that more, I'd recommend you check out further.
And you were talking a bit about maladaptive ways of coping.
Mm-hmm.
And this person was wondering if they see people who are very rigid or perfectionists. Is that kind of maladaptive coping mechanism?
Yeah, and I think kind of going back to that internal family systems view, I see those things tending to be like a protective mechanism. So they've maladaptively learned how to use that as a way to stay safe, avoid, numb, not get too close, but ultimately to self-protect and preserve.
And a bit more on dissociating. So when someone's dissociating during a session, they're wondering kind of what approach is safe to bring them out of that and kind of toward a more grounded state.
Yeah, and we kind of talked about this earlier today, but that would be things like some of those polyvagal exercises. That could also be anything that's going to help kind of trigger or acclimate them more to being present or like using the logical side of their brain. So I gave the example of math problems. This could also be like grounding, like tell me 5 things you see, 4 things you hear, like going through kind of those things. You'll find that this happens with trauma work quite frequently, but it's to get them to kind of be a little bit more regulated. The skills we're going to learn this afternoon are also going to be great things that can help to get them regulated or back in that window of tolerance.
And someone asked, do you always have to inform clients that you're going to be using EMDR?
Yeah, I think that's important. Just because it is different, and I think that that's just good practice of clients need, especially with trauma histories, like it's so important to know what to expect and to know what's coming. They deserve a voice and a choice in that. And as like complex trauma survivor myself, I can tell you, and I've seen this with a lot of my clients, the importance of, I want to know what someone's going to be using and why, So I would caution you against using interventions without keeping them informed of what's going on, because that can trigger a lot of like mistrust and feeling like a little bit misled and not having a voice or a say in what's going on.
And then last one for now, does a person have to be able to clearly remember details of a trauma experience or connect strongly to the associated feelings of that for EMDR to be effective?
Yeah, great question. And honestly, no, that's one of the things that separates EMDR. So EMDR is not used to like access like repressed memories or anything like that, but it's to target what's left there. Even if it's, I don't remember this happening, but I've been told this is what happened to me, you can even target like, well, how does it feel knowing, you know, that you don't have memories to this? Like, what does that bring up in you not knowing? Or is there any reaction you have in your body when you're told that these things occur? That's one of the nice things with EMDR that makes it such a, like, I guess, user-friendly approach, is that we don't have to get into the details of necessarily what did happen.
That's it for now. Keep the questions coming. www.pesi.com/Ask Megan. And I'll jump back on the next time it's time to share some of this.
Okay, thank you. I did see, I know there was one question that we might not have gotten to that I wanted to speak to for a second, because I did think it was a good one and one that maybe some of you can relate to or have had as well. I saw someone had shared that they had been trained in EMDR since 2017 and had been using it, but found that maybe they'd just do it about once a month or with like maybe one client or whatever, and that clients would seem to get bored or lost, and asked if I had experienced that or would be resistant to like doing any resourcing activities, and asked if I had any thoughts on that, which I thought was important, especially with what we're going to move into. We're going to be covering some of this as well, but yes, that can happen. And what that usually tells me is it tells me that they need, either they don't want to do it. EMDR isn't a one size fits all approach. Some people love EMDR, some people aren't interested in it. Again, it goes back to client choice. Those, though, that are maybe like not ready to do it or resistant to resourcing, that usually tells me that they're not feeling safe enough in their bodies or with themselves to develop those resourcing skills. I would also probably encourage you to expand your list of resourcing options, which there's tons. I've had to get really creative with some ways that we resource when maybe things like Complace or Container won't work. And then typically, I mean, I have a lot of clients that love EMDR, but they don't want it every single session. They want like, you know, maybe 2 EMDR sessions a month. And maybe in between there, we're doing talk therapy, or maybe we're doing an EMDR session and then a processing session, and then an EMDR session. And then when I say processing, like talk therapy in between. So that EMDR is a lot, which you're going to kind of find and see. And so I love EMDR, but me personally, I wouldn't even want to do EMDR every single week, right? With my therapist, I kind of need like a moment to regroup and to share what I'm learning and new insights. So I think sometimes it can be used too frequently that way. So I like to use it a little bit more like kind of staggered. I think it creates a lot more safety. But one thing too is that sometimes with the clients that maybe appear like they're bored, that to me is indicative that they're either not ready to do it, or that maybe they're needing more interweaves and directives from you, which those of you that are trained in EMDR will know what I'm speaking to. But that's where I found like internal family systems and some other things that you can integrate together tend to do a lot better for those kind of clients where there are more barriers or resistance. So those would be some of my kind of recommendations related to that. Okay, so I'm going to pull back up our slides here. Get back to where we left off. And I know one person asked, if we could see you guys. I wish that we could see you guys. I wouldn't feel like I'm just talking to a screen. At least I can interact with Ryan a little bit, but it would be nice to see some friendly faces. But I hope we're all staying kind of connected and engaged here. The rest of today will be pretty interactive for a little bit, other than when we did the demo. So hopefully that will be useful and kind of fun for you guys and help you stay kind of engaged. So like we learned before we went to lunch, EMDR is based on what we call this 8-phase model. And there's 8 specific phases that we work through when we're following this true process of EMDR. Now, I will say that sometimes the phases to me are a little bit confusing. To some people, they're not. I'll say that I've had to learn how to conceptualize them a little bit differently. But that gets into some of the later phases. The first 2 phases that we're going to talk about, they're really straightforward and there's less confusion here. So we're going to look at what these 8 phases are. And the first phase is just really like what we already do in traditional therapy. This is history, treatment planning. Essentially, this is all through a trauma-based lens. That's why we went over everything that we did this morning, because I have to have that lens and that framework, especially when I'm going to use something like EMDR to be targeting some of these symptoms and behaviors and other triggers. So everything is just more trauma informed in this history taking and treatment planning. We're going to go through some different ways that we can do that here in just a minute. But same thing, we're looking at symptomology, goals that they have. We might be screening for dissociation here. And then phase 2, and typically I kind of do phase 1 and phase 2 kind of together. To me, they're kind of, you can kind of interweave them together with each other. And there's some overlap there. I found that typically when you're kind of building rapport and you're in this early history taking and treatment planning, as you're gathering that information, we're bringing up all the junk, right? Sometimes it's nice to be able to give them skills to practice and take away. So that could be some of those polyvagal exercises we did. That could be some of the body scanning or body tuning exercises. And then we're going to learn some more of the true preparation or resourcing skills in this phase 2 this afternoon. That's what we're going to get into. So after we've kind of spent an adequate amount of time in phase 1 and phase 2, that's when we move into phases 3 through 8. Now, I will tell you guys a couple of things that I always find interesting. So people seem to think that EMDR is just when we're doing like an actual trauma processing session. And that's what true EMDR is. That's part of the 8-phase model of EMDR. That is not the only part of EMDR that makes it EMDR. So even these early phases are part of the EMDR model. So keep that in mind. Some clients, this is another question I get asked a lot. Well, how do you know when they're ready to move from like phase 1 to phase 2? Or how do you know when you've done enough in phase 1 and phase 2? And to me, there's some pretty straightforward giveaways that will let you know that they're ready to move on. So first and foremost, that we've developed and established really good rapport, that there's a level of comfort, there's a level of trust that's being built between myself and the client. Then that the skills, this is the one that we really want to identify and watch for. So the skills that I teach in preparation, they're able to do and they're using them. And we'll get more into what this looks like. If they're unable to do the skills that I'm teaching in these early like kind of phases, then that means that we need to stay there and do more work until they're ready to like utilize those. Maybe we need more like just normal talk therapy. Maybe we need more somatic and polyvagal kind of interventions. Whatever that might look like, that just means that they're not ready to move forward. I will never move forward in doing EMDR if they're unable to do any of these preparation or preparatory skills. It's just kind of like a golden rule. So this can just really vary depending on the client of how long we sit in this phase 1 and phase 2. Because again, you kind of just do them together. That's usually how it feels. And so you might be here maybe with some clients, maybe they've done a ton of psychotherapy in the past. Maybe they already have really good coping skills. They're able to do these resourcing skills that we're going to learn here in a bit really quickly and aptly. And so maybe that's just like a couple sessions that you do these things, and then you move into starting to target some of the specific trauma incidences that we'll talk about and look at. In other cases, you might be here for like weeks upon months. And this might just be really teaching them those grounding, resourcing skills, really trying to help them feel safe in their body. Maybe it takes longer to build that rapport, create safety, but I'm really never going to move forward until they've been able to adequately do these preparation skills. So for now, we're just going to look at phases 1 and phase 2. And we'll come back to the rest of the phases as we move on, because I don't want to give you too much information right now and have you get lost kind of in translation. So remembering that we talked about the model of EMDR being on this 8-phase framework, this 8-phase model, and also on this 3-prong approach. So meaning that in order to really successfully reprocess when we get into the later phases of EMDR, I have to know that they're going to be able to tolerate going into the past, dealing with present triggers, and that there's anticipated future things that we need to target as well. So in this early phase of history taking, I really want to see what some of those, each of those categories hold, right? Like what are the present triggers? What are the things from the past causing disruption? And what are those fears of the future? This I know is going to be fundamental as we move forward in helping them access this adaptive information processing, that natural adaptive resolution in their brain. So I have to be able to identify and see kind of the bigger picture and how all the puzzle pieces fit together. Me as a clinician, that's going to help me be more prepared for what we get into, because EMDR kind of feels like a maze. You never know what might come up. You never know where something may go, which you'll see and kind of get to experience a little bit. So you kind of have to have some clear picture of what and how everything is like interconnected before you get into true processing. So it's part of why in these early phases, really identifying those past, present, and future kind of scenarios that are causing distress are going to be important, because that's going to help you kind of know to some degree as the clinician what to expect when things come up. So there's a couple things with EMDR as we even get into resourcing that I think is important for us to remember as clinicians. EMDR to me is a very different clinical approach than most other therapies that we're used to utilizing. And it requires us to kind of take on a different therapeutic kind of role and response. And so a couple of things to keep in mind with this is that because EMDR has kind of a free association experience, which you guys are going to get to kind of experience here in just a moment as I teach a couple of these resourcing skills, what we know is that we have to really respect and accept whatever the client has come up for them. So one of the golden rules with EMDR is this common phrase or saying that there isn't a right or a wrong way to do EMDR. That's part of the beauty and freedom within EMDR. There is no right or wrong way to do this. Whatever comes up for someone during their processing has meaning and has purpose, even if it feels completely unrelated, that's okay. And EMDR is not about us overanalyzing and interpreting things as the clinician. That is not what we do. So it's less about us, and this is all about the client. This is a client-centered approach, And as the clinician, you have to really learn how to stay out of the way. And this is where I tend to see clinicians struggle the most when they first get trained in EMDR, because our natural tendency is we want to like help them kind of like process or explore something. And you kind of have to learn to do that in a little bit different light within EMDR. So we have to learn how to just accept the client's experience, even if we don't agree with it, or if we think, you know, it was related or should be interpreted a different way. You don't do that within EMDR. You have to really respect what comes up for them. And part of this is about we don't want to what's the word I'm looking for? We don't want to disrupt their natural healing process. So all of us have, again, that natural kind of healing adaptive resolution center in our brains that we're hardwired for. That's individual and different for each of us. So we need to remember that as the clinician. I don't want to disrupt their natural adaptive resolution. It's going to look different than mine. That's okay. I really want the client to make the decisions. So part of what I really appreciate about EMDR is it really encourages clients to learn how to trust themselves, to trust their own insight, to trust their own decision making, to lean on their own understanding again, to really get back in touch with listening and honoring their voice and their choices that they want to make. This is really critical in any kind of trauma treatment. So I really want them to make the decisions. And I'm going to avoid interpretation as much as possible during the process. And I'm really going to validate every attempt that the client makes, which is going to be important. And when I do have to intervene, I'm always going to be asking questions, kind of like a motivational interviewing standpoint. So they're always going to be open-ended. And I'm teaching them how to be curious about their experience, about maybe different parts of themselves or different behaviors that they have. I'm teaching them how to use curiosity instead of judgment to kind of interact with themselves. So again, us as the clinician, if we get engaged, we're only going to be utilizing kind of these open-ended questions. So in this phase one, we've gone over a lot of this, but we're going to look at a couple like kind of key things that I like to touch on. So obviously one we've kind of already covered. I'm going to talk to you about this timeline in a minute. This is one of my favorite activities to do really early on that I've seen create and establish a lot of resources that can really help those clients that maybe get blocked with creating resources. Also looking at this attachment, these early attachment relationships like I talked about is important. So what does family history look like? Maybe it's a genealogram. What are some of those earliest memories that they have? And what I'm looking for here is memory recall. And usually when there's gaps in memory or missing information, what that usually tells me is that maybe there is some type of trauma that occurred right before or during that time period where there are some gaps. And then we talked about these goals. So some of these questions might look like, what was the household composition growing up? Who did they learn to rely on for practical help? Who did they rely on for emotional help? We talked about some of those physical health screenings. Who do they feel safest with? Who are some of their closest relationships? Who was their closest relationship as a child? And then what were some of those childhood strengths? What are their current strengths, or what have they been told are their strengths? Any history of addiction or substance use disorder in their family or personally? Who made the rules in the home? Who enforced them? What type of discipline was used? How are disagreements solved? How do they solve disagreements now? Any major traumas? And then again, those patterns, right, of trauma or any repetitive patterns or behaviors that we see. And then how old were they when maladaptive coping began? So this means, so to me, I think that we know that anyone that's experienced trauma, I always want to know what their vice is. How have they coped if they haven't like healed or worked through their trauma? And there will be maladaptive coping to some degree. That might just be avoidance, withdrawal, isolation. It could be drinking. It could be relationships. It could be a myriad of things. But how old were they when they first kind of started leaning on some of these other ways to cope or escape dealing with their emotions? So I'm going to pull up this timeline in just a second, but one thing that we're going to look at, I want to know, I'm looking for things that are still triggering them from the past, things they feel like they haven't been able to work through. And I'm also wanting to look at how much of their time and focus is spent living in the past versus the present. And sometimes what we'll do is, you see here, I have utilized bridge back or float back techniques. So what this means is if they start describing kind of triggers for me and symptoms, I might utilize something where I ask them to bridge back or float back in time. And when was the first time they remember this being an issue? When was the first time they remember reacting this way, coping this way? We're trying to identify those early past experiences. So I'm going to pull up this timeline and I'm going to show you. This is one of my favorite things to actually utilize. In this early phase. And I'm going to talk about why. It has less to do with the negative and more to do with the positive. So I know as clinicians, we've all done timelines, but I'm going to talk about what is different in this regard for me, especially as an EMDR therapist, what I'm really more kind of focusing on and honing into. So I like to do kind of 5-year increments on this. And I kind of just want to know like a timeline of life, like we would do with any other kind of therapy client, right? And I know some of you will ask, well, like a lot of people don't remember what happened between 0 and 5. Well, what have they been told happened? So I'm looking for like who raised them during that time, what kind of family were they born into, did parents get divorced, was there homelessness during those early first 5 years, were they in someone else's care? I'm looking for those kind of things. And then if there's any kind of chunks of time that they don't remember, same question, what have they been told about that time? So we get all the negative things on there that we want to work through. Those are those past kind of lingering traumas that maybe they feel like they haven't been able to resolve or get past. And then what I love about this timeline, and you're going to see why here in a minute when we get into the resourcing skills, is I like this more for, and I call this kind of a resiliency timeline. This is what I'm more interested in. So I'll start with the negative. And then what I do on the top of this line is then I want them to identify anything positive that helped them cope and survive during these years when all this stuff was going on. So this could be like, did they have a favorite pet? When they learned to ride their bike? Was there anyone during that time that was like kind to them or extended like grace or help? This could be something like a favorite teacher they had. This could be maybe a favorite friend. And I want anything that was significant or positive that occurred during that time. So even though the trauma was occurring, I'm going to get really curious and help them really explore what helped them survive during this time. What were they leaning on or looking forward to? Now, a lot of the times, and this is where I'll challenge you to get really creative as well, I'm looking for other things. So who did they look up to at this age? Who was like their hero? Were their favorite like comic books or movies or musicians that they looked up to or athletes? And I'm going to note all of those on this positive kind of timeline. And these positive events could be anything that gave them hope for the future. So it could be recognition, like it says on here, from others, achievements, awards, special time, maybe a positive memory, whatever it is. And we're going to make as thorough of a list on the positive, almost more thorough than we're going to do on the negative. Because the negative side I call more of like a working timeline that we're obviously going to be coming back to and adding to the more that we build trust and safety with each other. But this resiliency timeline is what's going to be really pivotal to me and what's going to really help me have some successful resourcing in phase 2 when we enter into this preparation kind of phase. So this is that timeline of events. And yes, I will add it to the documents that you get if you didn't already have this one. All right, so I'm going to go back over to our slides here. And so not only obviously on the timeline, we're looking for those common themes, we're identifying kind of goals, what we're going to target. Usually we'll see the most traumatic things. That could be maybe the 10 most traumatic events, maybe it's 5 or 3. And then sometimes what I also am going to do is I'm going to identify the beliefs that they've held about themselves because of these things occurring, which we'll look at a little bit more. So because this event happened, this negative event, what has it led them to think or feel about themselves now? So that resiliency timeline is going to be important. Also, I personally like to utilize when I'm doing kind of attachment work and I'm kind of identifying maybe some of the barriers that we might run into. I like to use that addicted family system and identifying who they were in that family of origin. So were they like the golden hero child? Were they the scapegoat? Were they the lost child? Where did they fit in? Were they the mascot? And this is going to tell me a lot about how they learn to survive and what they feel safe either discussing, but also behaviors and reactions that have been kind of normalized. And then obviously that adverse childhood experiences, the ACEs is good. Sometimes identifying their attachment style as well is going to tell me kind of maybe some of the barriers that we're going to run into or protective features that they might have. So we're going to start with one of my favorite exercises because we just got done talking about that timeline and that those resiliency kind of factors on that timeline. And again, this is going to be an activity that you will get, so please don't worry about taking notes. You will get a handout with this. It'll give you the directives on what to do. So I just really want to encourage you to let yourself have this experience and see what comes up for yourself. This is a really great way to see and experience what our clients go through, but this is also going to give you and start to give you a glimpse of what can come up in EMDR and the free association experience that's associated with it. So this has been modified. This is what I call this. Some people call it Team of Allies, or maybe some other different things. This comes from Laura Parnell's work, who's an amazing attachment-based EMDR therapist. And I'm going to kind of walk you through just identifying some of these characters. And then after we identify these, I'm going to teach us just a basic bilateral stimulation technique. We're going to learn some more here in just a little bit. But just to do this exercise, we're going to kind of try out one form of bilateral stimulation together. So to start, we see these categories that are kind of listed here. And I'm going to give you some directives, and I want you to just think of whatever comes to mind for yourself for each of these categories. There's a couple of caveats too that make this, I want you to imagine being as creative as possible. So one place that I'll see kind of people get stuck with resourcing is they try to think about things that they have right now. So like real physical people, tangible things. I want you to be really creative and really try to pull from things that have genuinely provided each of these categories for you. And I'll give you some examples for each category. So the first one, you can just write down or just think of these as we get started. The first one is I want you to think of, these can be people, objects, animals. It can be people dead or alive, real or imagined. It can be characters from books. It can be heroes or icons that you look up to. It can be anything that comes to mind for you. There is not a right or a wrong thing. So I want you to think of first anything or anyone that comes to mind or would represent strength or protection. And some examples of this might be, I've had everything, our clients tell me everything from like just envisioning like a shield. I have one client that always talks about The Rock, like the actor. Always hear Harry Potter characters and Lord of the Rings characters. But anything or anyone that would represent strength or protection. When you think of strength or protection, what do you see or think of? Just kind of make notes on that. And one caveat with this is I don't want this to be anyone that's caused significant harm or trauma to you. The next category is I want you to think of, again, anything or anyone that would represent nurturing, love, or acceptance. So when you think of unconditional love, kindness, acceptance, positive regard, someone or something that would be very nurturing, warm, and loving, what comes to mind? And then I want you to think of anything or anyone, again, that would represent wisdom or knowledge or intellect. So when you think of being wise, what comes to mind? And then I want you to think about spiritual. So when you think of, and I'll give you a different way to think of this, to be anything that reminds you that you're connected to something greater or bigger than yourself. So it could be nature, it could be the universe, it could be our connection to another person, it could be a higher power. And then the last category I want you to think about is this ideal self. So you as you, like the best version of you, or who you are striving to become, those positive, true, unique characteristics that make you you. You can list some of those characteristics out. So you might think of you at your best. How would you feel? What's kind of the image you have in mind? What would you be doing? What would your mood be? How would you handle struggle? And then if I'm doing this with a client, this would be where then we'd check in. So I'd have them share for me everything that they came up with that they put on this list. So we'd go through and I'd have them tell me about kind of who made the cut or what made the cut or came up for each category. And you'll be surprised, there'll be everything from, I mean, this can be super creative, like I've told you guys already. But there can also be times where it's like, well, I felt bad or guilty that my mom wasn't on my list of nurturers. That's okay. This is their list. It doesn't mean that mom hasn't been nurturing at times or whatever. But we want this to just be the first thing that kind of came to mind. And also why I'm having them share this with me before we add the next component is I want to make sure that they didn't identify anything that was like negative or that I know has caused trauma. Now, the other kind of part of this too is it might be like, I really couldn't think of anything for figures of strength and protection, or nothing came to mind when I thought of wise individuals. So if that happens, this is part of why I like that resiliency timeline. So if we've already identified some of those positive things, then it can be like, well, I know that you said like, you know, in first grade, the teacher you had was just like so attentive to you. Could she be someone that we just put on that nurturer list? So that resiliency factor is really going to help you identify those positive resources that you can utilize as you're establishing each of these kind of categories. These can also be parts of themselves as well. So sometimes I'll do this where I ask them to identify imaginal or actual things that they can identify. And then other times I'll do this exercise where for each of the categories, they identify each of these aspects of themselves. So you might have to help them with this. But again, if they do choose something or someone that has caused harm to them or been a main player in some of their trauma or struggles, I'll usually say, I don't want this list to contain anyone that's hurt you. So is it okay if we like, you know, put this person on the sidelines for a minute? Because I just want this to be people that have been positive for you, even though that person maybe has provided some positivity in your life. I really don't want anyone on this list that's caused harm to you, because I want this to feel 100% safe. So after we go through that, we identify that. It's okay if there's overlap. Some of the categories, very common. Now we're going to add this first element of bilateral stimulation. And I'm going to walk you through this. Again, I'm just going to give you an example of one form that we're going to utilize. We're going to be learning about more about the bilateral stimulation and different forms that you can use here shortly. But I want us to have kind of a sneak peek of this early resourcing skill that is kind of from this framework of EMDR. So what you're seeing me do is I'm crossing my arms and we're doing what we're going to call the butterfly hug. And so you can go ahead and do that if you want. If it's uncomfortable to cross your arms and you don't want to do that, you can just lay your hands flat on top of your legs. And in a moment, we're going to add some just light tapping or movement from right to left. And if you're doing the butterfly hug, we're going to do the same thing. We're just going to tap. And we're not tapping at the same time. We're rotating, okay? So this will feel kind of like guided meditation. The only difference is going to be that you're going to notice that we're adding the tapping. You're going to continue with the tapping the entire time that I'm talking. I'll prompt you and I want you to stop. And then I'll direct us from where to go then. If you get confused on should I be doing the tapping or not, if you see me doing it, it means that you should be doing it. So I'll tap anytime that I ask you guys to do the tapping. I like to co-tap with you so that we can kind of be somewhat co-regulated together. So again, please don't worry about taking notes. Just allow yourself to have this experience. Okay, so I'm going to invite us all. We're going to take a deep breath in. We're going to let that go. And most people like eyes closed. So with eyes closed, go ahead and you can either start that butterfly tapping. We're going to just continue it from right to left. You're going to do this the entire time I'm talking until I tell you to stop. So go ahead with eyes closed, adding those taps. I want you to start with noticing anyone or anything that represented those elements or figures of strength and protection. Notice what protective qualities or representations of strength and protection these images hold. And then I want you to notice anything or anyone that came to mind for that unconditional love, acceptance, nurturing. Notice the kindness, the grace that would be given. Maybe even notice the positive regard or feelings you'd have. She thought about that acceptance and love. And I want you to notice anything or anyone that came up that represented wisdom, intelligence, intellect, or knowledge. Notice the sound mind, the positive advice they might offer or give, their insight. And then notice any of those things that would represent or remind you that you're connected to something bigger or greater than yourself. Those spiritual elements or attributes. Just notice what they remind you of. And then see yourself in that ideal place, you at your best, working towards being or becoming that person that you want to be. Notice those unique, innate traits and characteristics that are positive about you, that you want to embrace. Go ahead, we're going to take a deep breath in. We're going to let that go. Go ahead and stop those taps if you haven't already. And typically, if I'm working with a client, this is where I'm going to ask them to tell me what came up. What did they notice? So I'm going to walk back through, kind of tell me the imagery that came up. Some people will maybe hear things. Like that they thought about, I was just kind of thinking of these words. Sometimes it will be images, like I saw, so-and-so there. This can also elicit a lot of emotion. So if you did this and it brought up emotions for you, know that that's normal. That's very common. That's okay. I think sometimes as clinicians, we think we have to keep the emotions at bay. We have to keep everyone regulated. Sometimes it's okay when we're a little bit safely unregulated. It's a release. Sometimes that means we feel safe enough to honor those feelings and those experiences or those emotions. Feel it to heal it, right? And then oftentimes I'm going to ask if anything changed. So were there new people or images or things that came up that maybe they hadn't identified before? Because oftentimes that will happen. So now we're going to go back into the second part of this exercise. So same thing. You felt like the tapping was disruptive for you. Feel free to, you can just follow kind of my guidance. If it was too disruptive, don't worry about continuing. If you were fine and able to kind of carry forward with the exercise, then I'm going to ask you to add that bilateral stimulation again. So everyone go ahead. We're going to take a deep breath in. We're going to let that go. Go ahead with eyes closed again. Go ahead and start those taps for me once more. And we're going to continue with these taps till I prompt you to stop. And once more, I just want you to draw your mind to bringing up what came to mind and represented those elements of strength and protection. Notice what represented those acceptance, figures of unconditional love, kindness, any of those nurturers. Notice too what came to mind for you for those elements or characters or figures of wisdom, insight, knowledge. And then if you can even draw your mind to go to that place where you think of those things that remind you that you're connected to something greater or bigger than yourself. And then once more, kind of just see yourself in that ideal best state, even if you're not there yet. What would that look like or feel like? What are those innate, unique, positive characteristics or qualities that you hold within that you want to embrace? And this time I want you to imagine that we're going to ask all of these figures or objects or images. I want you to imagine them just kind of surrounding you as you are now. Kind of drawing them closer to you or closer in your mind. And if you could imagine them surrounding you, what would they tell you or remind you of that you often forget about who you are? What would they leave you with that you often overlook about yourself? And just notice that we can come to them anytime that we need to, even if it's just in our mind's eye. We can pull from any of their strengths that we need to. And just listen and hear what they'd offer or extend to you. When you're ready, go ahead, take a deep breath in for me. Let that go. Good. And stop those taps if you haven't already. And then again, if I'm working with a client, you guys can all think of this for yourselves. I want to know kind of what came to mind that time. What did they envision? What did they imagine? What did they kind of, what came up for them? Again, free association experience. So what did this look like? And what were they left with? So maybe they were told something, maybe they were given something, maybe they were offered something. And that can kind of become a mantra. And so this is a really great exercise. I love for healing attachment wounds, even if it's just imaginal. because we know that a lot of trauma survivors struggle to identify or maybe have never had people that would fit each of these categories. So again, it's not about people that they have. This can be very imaginal. This can be characters in books, movies, whatever. You can get very creative here. But even the idea of forming a connection or a secure attachment, even just from the framework of our mind, of envisioning that, what the mind sees, the mind believes, can really start to help repair some of these early trauma and attachment wounds. But these are going to be resources that I'm going to use when we get stuck in processing, when I need to challenge a client to expand their view or their insight of what's taking place. I'm going to use this a lot. Like, what would these figures, what would your restoration team say to you? What would those identified protectors, like if you could have a conversation with them, what would they say to you? This can be a really good way to jumpstart some blocked processing, and you can make some really good progress this way. This, like I said, is probably one of my favorite and most used resources that I utilize all the time with clients. Clients tend to love this one. And again, it can elicit those emotions. You might even notice if you had emotions that come up, just know you weren't doing the exercise wrong or anything like that. But there's always something to learn, even if this doesn't go the right way. We kind of work from this standpoint that whatever comes up has meaning and purpose. Even if it doesn't go perfectly, it's telling us something that we can learn from. So I do want to pause and take just a moment before we kind of move forward and learning some of the next steps of this process. This would be one of those preparation phases. I really want to know if you guys had any questions that's just specific to that exercise that we just did. We're going to learn some more, but if there was anything that kind of came up related to that, I would like to go to Ryan for just a second and just see if we had any questions related to that.
Taking a look right now.
Okay.
To kind of see what's coming through. There's lots of questions, but go ahead and throw them in quick. I'm just going to side some screens.
I'm putting Ryan on the spot, you guys.
Trying to read
Right.
quick and rearrange. Here now they're filling up so fast I can't read them. If any sad memories came up, how do you work with that?
So if sad memories come up, oftentimes, and this is what you guys are going to learn about EMDR, because I think within, oftentimes, and I'm not saying this, so don't take this as a blanket statement, but know that it's okay to let them sit with the sadness that came up around that. That with EMDR, we teach them to lean into the feelings and to sit with those things so we can notice that sadness. Is there any positive element that they even want to take away from the sadness that came up? Oftentimes it can be sadness like, I realized that I didn't have a lot of these people there. We can honor that. Sometimes that might be what's acknowledged. And then I'll usually always try to validate, like, I love the fact that even though you didn't have any of these people, you still came up with all these creative ways to take care of yourself and to love yourself. Like, that's an amazing, unique skill. Hey, Ryan, what else you got?
This is a lot of it. There's a lot of the sadness. So again, I don't know if you want to elaborate more, but someone said I started crying almost immediately.
Yeah.
I want to know why.
Oh my gosh, you guys, crying is normal. Okay, so this is what you're going to find out about EMDR too. And any of you that have done it know. So EMDR to me is like, if you want to make someone cry, do EMDR. EMDR will make anyone, it gets through those emotional barriers. But restoration team, actually most of the resourcing team, this one in Complace, so common to elicit emotions where it's like they start crying. Sometimes it's over sadness. Sometimes it's just over like I'd forgotten about some of these like people or these things that meant so much to me, and getting to sit with them for a minute, it can be tears of like honor and gratitude too.
And someone asked, do you do this activity with the client periodically over the course of working with them, or should you only be doing this during the first phase?
Yeah, so I use this one all throughout EMDR. So this is one of my ones that I like to teach right out of the gate. And you're going to see, I'll give examples of this as we see some of the demos. You'll even see in the demo that I play that I is one of my therapy sessions that you'll see tomorrow. You'll see the way that I integrate that restoration team. But I teach this and then I tell them to use this outside of session. So I'll say things like, okay, so we did this restoration team. Now, if you're having like, if you get triggered or reactive this week or whatever it is, I want you to take a moment. They can add the tapping and they don't have to. And I want you to just think about like, what would the restoration team, what would they help you like figure out or maybe discern from whatever experiences that you're going through this week. And then I also use it as a way to approach working through some of the ongoing trauma, which you'll get a look at a little bit later.
Then we've got a couple about the tapping.
Yeah.
So we're going to throw them both at you at once. But one was, what do you say to clients to explain why you're doing the tapping, like if they don't really feel connected to the tapping? And then another was, how fast should you be doing it? How fast do you tap?
Yeah, so I let clients pick, especially in a virtual space like this, or if they're doing their own in office, which we'll talk about when we get into bilateral stimulation here in just a bit. But I let them find their own rhythm. So some people might be slower. It's just enough to know it's keeping them in the here and now. So I explain it by, I know the tapping's weird. I just call it what it is, right? Like I know that it's odd, but this is going to help you stay like present and grounded. And then I do just explain if I've already done psychoeducation on what occurs with the brain. The tapping is what helps you stay in kind of that green light region. So this tapping is like causing neurons to fire in the right and left hemisphere, which is forcing that logical brain to come onto line or come online. But it's also going to help you, like I always think of when you add the tapping, it's like you're securing it into the memory networks.
And then there's a lot of folks looking for kind of reminders on what happens if people can't come up with something. Mm-hmm. Fill in certain questions, whether they can't come up with anyone or anything for wisdom, like how should you handle that?
But maybe you might leave one of those categories off. I was doing consultation yesterday, and one of my clinicians in there was funny. She's like, yeah, I hate the ideal self, so I just took it off the list. So I don't have my clients come up with that. So you can, I mean, you can do that. There might be maybe one category. I don't want that for like multiple categories. Maybe they can only come up with like figures of protection, right? Then maybe you just start with that. Also, that's where we really go back and you have to be creative. So I might say like, so tell me like who you really looked up to as a kid, you know, like what were some of your favorite books, movies? And then I might say, you know, well, could we use like Indiana Jones as like a figure of protection if they list that off? So you can help them come up with those characters. And that's what makes EMDR kind of fun.
And again, a lot of people having emotional reactions to this, but saying, okay, this feels really powerful. What do I do if this is too emotional for someone? Like they feel like they can't perceive. Like, what should we do with that?
Yeah. So again, I would just have them, we're going to have them sit with that. So when those emotions come up, if it's too much, a lot of the times I'll just ask them maybe to even just sit with like some safe havening, where they're like just rubbing arms, like, you know, their arms like this to kind of create that dual awareness, but also just to notice it. What does it feel like in their body? Where's it coming from? Maybe I'll prompt them to do some of that diaphragmatic breathing, or maybe we'll switch into like a polyvagal exercise. But usually they do pretty well with this. We're going to learn a couple other resourcing techniques, which I haven't introduced yet, but I might also go to one of those, and that will usually help get them grounded pretty quickly. But usually this one, if that comes up, it might just be honoring maybe the grief or sadness that's there and just the permission to do that. to just sit with those feelings is sometimes needed, because usually as trauma survivors, we're told how to think, feel, act, and behave. And being given permission to just sit and be sometimes is really more healing than we recognize.
And then we've got someone asked, how do you respond to messages from their support individuals that might become or reflect negative messages?
Oh, I've actually never had anyone have a negative one. But if they did, I would kick that person off their restoration team. First of all, I'd be like, they're out. And then I would try to find like the one that they had the strongest connection with, the one that was like the most powerful. What would they say to that? So maybe to counteract if there was a negative message that was maybe shared. Or I might do something like you'll see a little bit later where I pull up kind of the positive cognitions and let them pick something that maybe the restoration team reminds them of. And instead of having the restoration team maybe like imaginally speak to them, it's just seeing those supports and then holding like a mantra that they pick.
And a number of people asking this again, one of these, what can I do? And can I use this? Like, so if I don't go on and get 30 or 40 more hours of EMDR training, is this something I can use with clients?
Yes, I'm going to tell you yes. And some people will be mad at me for saying that. And I'm going to tell you this because I think that these are early coping skills that we should have the freedom to use as clinicians that are treating trauma. And this is something that if you use it in a safe way and you're a decent clinician, this is a positive skill to use, whether you do EMDR or not. And even with some of my clients that I don't do EMDR with, I still will do things like this. And I'll do kind of like a little bit different of a version where like I use what Brene Brown refers to this as what she calls her brain trust. And she identifies these people that have had like an impact on her, right? And restoration team to me is similar to that. So even if we don't maybe do full EMDR, like maybe a client doesn't like it, I'll oftentimes still identify these because it can still be a really powerful resource for them, whether they want to move on with EMDR or do some other kind of trauma treatment. I also will tell you guys, I love this one and the two other resourcing techniques that I teach you today. I love them for group modalities. So love them to open and close groups with. Can be really, really powerful. It can also be powerful to have other group members help them come up with maybe categories that they were lacking. So I'll have them all kind of sit as a group and they might tap, but it can be really powerful that way and a really good resource. So yes, use these skills to help our clients because clients deserve to have access to resources like this.
And somebody asked, sometimes they're the big area of support for folks. What if the client wants you to be on the restoration team? Like they envision you, is that okay? You know, how do you respond to that?
Depends on the client, right? We all know that. Yeah, I actually had, this is a good, last week I had in one of my clinical consultation groups with EMDR, I had a clinician that she brought this up and this is a great question. And she said, okay, one of my clients used me as someone on the restoration team. And she said, normally I'd be okay with this, but I also know that this person has a history of becoming fixated on people that she looks up to, and that I don't want to be like someone that she ends up like fixating on. So we talked about it's okay for now, but maybe we're going to look at how we could more creatively add additional supports on there. And touching on that, I'm okay with that if it happens and it's like appropriate. So if it's like, I know that I'm one of their only resources or one of the only people they feel safe with, like, yeah, you're going to be on there. That's okay. We don't want it to be where it becomes like a place of idolization or like where they're idolizing you though.
And aside from kind of the emotional sad reaction, there are a lot of people saying that they got tired or drowsy or sleepy, and they want to know, is that normal? What happens when that happens to a client?
Yeah, totally normal, you guys. And think about, this is a really great way to show you how activating we can get our nervous systems. Like, so I always think of the bilateral stimulation as what deactivates the vagus nerve. So a lot of the time when you do like these resourcing activities, clients will say like, oh my gosh, I'm so relaxed and tired now. And that tells me that they were probably somewhat a little bit elevated and now that they've come down. So very common. I just validate that for them. And maybe that's where we stop. Maybe they need to do movement if that occurs, but it's totally common.
This is another one that I think that you deal with a bit, but this is a person who works predominantly with men and finds that they often struggle to verbalize their feelings. So you're doing the exercise, they're not maybe great at verbalizing, or they're finding it uncomfortable to verbalize. Any guidance for that type of client?
Elements of themselves usually work well. So, what are the ways that they protect themselves and have been strong? What are the ways that they've offered love and support, even to others? What are the ways that they use insight and knowledge? And men work wonderfully with sports figures or whatever their interest is. So if you know, like, you know, they're diehard football fan, like who are some of their favorite players and why? What about favorite actors or, you know, whoever it might be? Usually that'll work really well. Also keep in mind with EMDR, they can share as much or as little as they want. So some, like you might have a client that's like, yeah, I had people come up, but I kind of like, I just want to like keep it to myself if that's okay. Like that's okay. They can do that as long as they feel like it was positive. That's all I'm going to check in about, but they don't have to maybe necessarily tell us every single detail. That's part of what makes EMDR a little bit more unique.
And then what do you do if you have somebody and they can't think of a real person, but they know, and they're kind of like, yeah, this is great, but it isn't real, and they're struggling with that. What do you tell a client who says something
I say, yeah, it isn't real. And then usually I will validate that for them. Like if I'm being honest with you guys, my initial restoration team had one real person on it. And it was a person that I had had like a 5 minute interaction with when I was like a kid. And I say, yeah, that's a real thing. And I can honor like the grief without it. Yeah, it sucks that there aren't a lot of people that we can like identify with that. But also, like, again, I'm going to re-stress this. Like, I'm impressed or amazed by the way that you were so able to creatively come up with characters or objects for each of these characters when you haven't had that. Like, what an amazing like attribute or trait that you were able to do that. You know, clients need to know that. Or this also can give us an idea of what we want to look for in people that maybe we form relationships with. And then I talk about how this is working on repairing some of those early attachment bonds that we've had that were broken that we deserve to have.
we've got a lot, so I might end with this one because I think we
go ahead. It's okay.
We'll visit more of them later.
No
but
problem. After the break, we can take more too. So give me one
you guys
more.
are doing great. There's a lot in here. There were a lot of questions with the tapping about like posture, positioning. Like, do they have to sit in a certain way? Can they lay down and tap? Those kind of any guidance there?
Oh man, guys, don't you love us as clinicians? And like that's such a clinical answer, right? Where we want to make sure we get it right and we know all the like biomechanisms behind it. Don't overthink it. That's what I'm going to tell you. So if you can keep in mind, do what is comfortable for the client. We're going to learn some different forms of bilateral stimulation, like I said today. But yeah, you can lay down and tap. You might fall asleep. That's totally fine. Not when we do processing, but sure, if they want to tap on their legs, if they want to tap, you know, their feet, don't worry about, you know, you don't have to cross the medial section. I always get asked that question. It's more just about we want that stimulation from the right and left side. That's what's forcing those neurons to fire and pulling that logic and emotional side of the brain in the frontal lobe online. So don't overthink the tapping. This is just one piece of it.
And we'll stop there, and I'll pop back down into the next round.
Okay, thanks. Great questions, you guys. I love the questions. And again, I wish we were in person because then I could ask and have all this feedback and normally get to see the way that you all respond to this. And thank you for those of you that actually allowed yourself to have this experience. Thank you for doing that. We never get usually the time to do this in trainings, right? So I think that's one of the nice things about EMDR as well. Also, part of the reasoning that we do some of these skills and I ask you to do them is you can relate what came up for you with clients, right? So if you're like, yeah, I struggled to come up with anyone that was a wise figure, use that as a way, to relate to a client or give them examples maybe from what have come up from you, or if you saw other things that people shared in the chat, that can be useful as well. So one thing that I want to talk about to keep in mind within EMDR, because you just got your first taste of how, whoa, the mind can go wherever it goes, or here's a barrier that the mind can run into. Or maybe some of you had that experience of, I wasn't expecting that to come up, but it did, or this person came up, I wasn't expecting that. Maybe some of you found like, I couldn't go there for some reason, I was blocked. Just be curious about that, whatever came up. Again, that's normal. That's part of this free association experience. One way that can kind of sometimes help us navigate the intensity of what comes up with an EMDR is I want you to keep in mind that with EMDR, we're not asking them to do, it's not exposure therapy. So that's not what EMDR is about. That's not the goal of EMDR. So what we use is we use a couple different metaphors to create a nice safe distance when we're doing processing, which processing I'm going to refer to as anytime I ask you to internally go inside and think about something. That's what processing means in EMDR. So anytime I ask you to internally go in and just allow yourself to have that free association, and you add tapping or whatever form of bilateral stimulation, that I refer to as processing. So there's a couple ways that we can create some safety and distance as a way to kind of help keep clients within the window of tolerance, to help them maybe like tolerate the overwhelming feelings that come up. And there's a couple different ways that we can do this. And you might even come up with your own distancing strategy, which you totally can. That's one of the things that I like about EMDR. It's a creative, fun experience. And I know that the imaginal piece isn't for some people. That's one of the things I like about it with trauma, because if you think about when we come up with trauma, and we're trying to come up with like, well, who are your supports? And it's like they don't have anyone on there. I mean, I'd rather have them think of at least an imaginal person than have a list where it's like they don't have anyone to identify, right? And I like that component. I just appreciate the creativity and really believe that that creativity leads to a greater capacity of resilience and healing. But one way that we can kind of expand or increase this, or their ability to maybe safely kind of step inside, is we want to stress to clients when we get in, before we get into like actual trauma processing, where we're targeting real traumas within EMDR, or even maybe with some of these resourcing exercises. So I'm never asking them to like relive any of these experiences. I'm not asking them to like go back in time and pretend like it's happening. Anytime that I ask them to do any work, I want it to be from a safe distance. So they're just observing this. So I'm not asking them to ever relive any of these experiencing or any of these experiences or things that we ask them to kind of think on. So Francine Shapiro came up with this train metaphor. And she said with this is the safe kind of distancing strategy where you can tell a client, I want you to just imagine that you're on a train, that you're riding a train, and the train's like passing, the countryside or whatever. And you're just watching the scenery go by outside the window. And every so often, if you feel like it, we can stop the train. we can get off the train, we can explore, maybe gather new information. Maybe we need to look at something a little bit closer. Or maybe we need to let something off the train that got on the train with us that we don't want to be riding with us or carrying with us. And we can speed up the train. We can slow the train down. We can stop the train. We can change directions. But they're in charge of the train and how fast or slow or where the train's going. And we just want them to notice like those images or the thoughts, kind of like they're the scenery going by outside the train window. And then when we kind of stop at each break, just kind of like you guys got a little taste of there, right? Where I had you add that bilateral stimulation, I would say, tell me what you're noticing or what's coming up for you now. Those are very common EMDR phrases that we utilize a lot. And I let them know that that's just, they can share as much or as little as they want, but that's just me making sure that things are progressing. It's giving me an idea of where we're going. And this distancing strategy is going to help kind of create a safe distance between the client and the experience. And it's also giving them the notion, we're letting them know that they're in charge of this, that they're in charge of the process. We're not going to keep them somewhere they don't want to be, but they're in charge. They have control over this. This is important. So that's the train metaphor. I like to utilize the movie screen a lot, similar to this. So I say, I want you to just like imagine you're sitting in a theater, and you can even use this one with restoration team if this was too emotional, right? Notice who would come up on the screen that would represent protection for you. So there's a distance there, right? It's creating some safety and a sense of control and tolerance. So if they're watching this movie, this might be, we can rewind in time, we can slow things down, we can fast forward through certain parts, we can pause or stop at certain parts, we can even turn it off or change the channel. But I just want to know, again, when we pause or stop, I'm just going to ask what's coming up just to make sure that things are moving forward and that they're not getting stuck anywhere. Because if they get stuck, I let them know that I'm going to help them. I'm not going to leave them in that kind of stuck place. And I'll tell you one thing I do with this. This will make more sense later with that restoration activity that we just did. So sometimes when we get into like where we're going to work on going in and revisiting maybe a traumatic experience that we want to reprocess, which you'll see what that looks like with EMDR in a bit, I might say to them, okay, like, so we're going to, we want to work through this memory and why this is still bothering us. So I want you to imagine you're sitting in the movie theater and we're just going to be playing it on the screen. But this time I want you to imagine that those figures or elements from your restoration team, they're sitting in that theater with you, and you're not having to watch that alone, that they're with you. And they're going to help you maybe see different perspectives. They're going to help you figure this out. But that intrinsic, even if it's imaginal support, is a huge element of reprocessing that works really nice in EMDR. Okay, so what we just did was obviously a preparation skill, or what we call a resourcing skill in EMDR, that restoration team. And in this restoration, or in this preparation phase, one of the things that we're doing is, this is where, if we haven't already, we're providing psychoeducation on what EMDR is. Then we're going to educate and familiarize clients with bilateral stimulation. And we're going to, again, go through that, like distancing strategies that we can work with to create some sense of safety and control. And then I'm never going to move forward with doing anything else in EMDR until they've been able to successfully do these skills in this preparation phase and use them adequately and successfully for a period of time. Preparation phase to me is one of the most essential, important parts of trauma work, but also really important for EMDR work as well. So I'm just going to cover a couple things before we go to break. So keep in mind that the client's job during any of these resourcing activities, so like you saw with restoration team, with the skills that we're going to learn after break, is their main job is to just notice what's coming up and just letting me kind of know what they want me to know. They can tell me as much or as little as they want to share. But I always tell them, just kind of let your brain go where it naturally goes, even if it feels completely unrelated or random. There's a meaning and a purpose there. But I want them to know that they're in control of the treatment process. And I explain to them, like, I'm not in charge. I'm just here as like a compassionate companion. So I'm like your guide. We're co-guides on this kind of journey. I'll help you when we get stuck, but we're companions on this. I'm not leading or taking over. I'm just there to help you if you get stuck. So my main goal as the clinician is to make sure that I have resourced my clients well enough and not taking them any further in this process or in any type of trauma treatment until they are ready for that, and until they can have used and developed, multiple resourcing. Remember, fancy word for coping skills. And then my main job is just then checking in, helping them if they get stuck, which we'll talk about how to delineate if they are stuck, and really to just trust the process. So just trust the process, that the process is going to work. And this requires us to really trust the client as well. And again, I know that I just said kind of the opposite of this, but to me, I really try to stay out of the guide role. I'm there if they need me to guide and direct, but we're really kind of like co-guides on this process. We're there to work together. This is a client-centered approach. And again, my roles with this too are going to be to make sure that I really educate them on the risks associated with EMDR, and especially if I'm doing EMDR in a telehealth space, like there better be a backup plan if we lose connection. How am I going to check in with them? The normal kind of like safety planning for any kind of trauma treatment. And just knowing that EMDR can bring up strong emotions, and then really educating and practicing and using these bilateral stimulation techniques and letting the client pick what works for them, and really practice and review those coping skills and those resourcing skills and safety planning. So when we come back, we're going to learn about bilateral stimulation and the different forms of bilateral stimulation. And then we will go from there. I'll take a few questions when we come back to you. So we'll be back in 15 minutes. So kind of close to 10 till the top of the hour, just maybe a couple minutes before that. Thanks, you guys.
Megan, this is one folks have asked a couple different times, kind of about the speed here. Can EMDR be done briefly and show effective results?
Yeah, we actually see it being really effective anywhere. I mean, and depending on what the trauma is, right? Especially if you're working with maybe like a single incident event, you can see really good resolution. I mean, in like 4 to 6 sessions. I mean, it really, again, it's individualized, but yes, you can see kind of that target. With complex trauma, if that stuff hasn't been resolved, I mean, obviously you probably need more, but yeah, it can be effective in shorter periods of time like that, and still make an impact.
And here's one that I've heard from time to time. Clients who maybe want to do EMDR therapy when they come to you, but they've actually done it in the past and had a bad experience. So maybe up for it again, but special considerations with someone like that.
Yeah, so most of the time, and this is a common one as well, maybe they just weren't in a place where EMDR was something that they were open to. Oftentimes, I want to know what their experience was like. So what didn't they like about it? what didn't they help, or what do they feel like it didn't help with. And then usually I'll tell them what is a little bit different about maybe my style or my approach. So like maybe they've never done like restoration team or maybe some other things. Like I might say, well, here's what I know, EMDR can do here. There's different skills that can be implemented. So I might share those things. I also might say, we can try it again. And if it doesn't, if you don't like it again, then we can find other things that will be helpful. But usually it's just about kind of seeing what they felt like were the barriers when they did it. And unfortunately, there are some clinicians that maybe just don't use EMDR enough or were trained ineffectively, where like they're just missing some things that would have been helpful for them.
Then there's a lot of questions about. I work with this type of population, and so I don't know the best way to, but I can rattle through some of them. And you can probably do
Yeah,
it.
you can
Can
rattle
I,
through. It's okay.
yeah, can I use EMDR with this? So we talked age and we talked young people. What about older people? So I work with.
Oh yes, love it with older as well. I used to do a lot of kids stuff. I do primarily just adults now. I did see one of those questions about like, what about the older, like what we'd call maybe geriatric population? Absolutely. I mean, again, depending on you're ruling out other factors, right? But yeah, I think that EMDR is effective and mostly is effective for adult populations. I mean, that's where most of it was studied.
And so it kind of the list kind of goes on, but things
Yeah.
about domestic violence,
Mm-hmm.
abuse issues. Is it something that you would use there with clients who have experienced maybe psychotic features? Like,
Yeah.
people looking for the specifics of
So let me talk about, yeah, so with domestic violence, and I think I saw another one on there that was like that you had shared with me, Ryan, that was like with betrayal trauma and stuff. Yes, I think it can be really effective. One of the things that I like about it is that sometimes, and if you think back to what we learned earlier today, EMDR really works on strengthening like that positive self-regard, like learning to trust yourself again, increasing your self-worth. And I think it really can help sometimes clients in situations where there's been maybe some betrayal trauma or even like domestic violence, where if they can learn and build up kind of their self a little bit more, maybe they have more strength to leave or to at least maybe cope or break some of those negative relationships that are occurring. So I like it there a lot. Psychosis wise, I will tell you, I'm not personally comfortable using EMDR with psychosis or kind of those extreme, like with extreme delusions or like schizophrenia or any kind of like really big psychotic episodes. I know that there's some EMDR clinicians that will use that. That's just not my focus area. I think that there's a lot more risk there. I do know a recent study did show that it can reduce some of those symptoms of psychosis in a controlled study, but I would just advise you to seek out maybe someone that specializes in that way, because that's um, not my emphasis.
maybe one of the other client types that's getting asked about a lot. People on the spectrum,
Yeah.
and people with ADHD. Is this something you can use with those populations?
Yeah. So autism, Sherry Polson, I think, yeah, and like I think I said that right. Anyways, I did. I had to think about it, but she has a lot on an autism. She has like autism prompts and protocols. Sometimes I actually really like it with that population. They process a little bit different, but sometimes it's really great at getting them to maybe expand some of the rigid thinking. So I actually like it that way. There is evidence around that. There's some good interventions that are supportive of autism spectrum disorder and the ways that EMDR can be utilized. The other one, too, what was the other one that you mentioned?
ADHD.
Oh, ADHD. Yes. You see a lot of great work with ADHD. One thing that I always find hands down is people with ADHD like when we get into the first resourcing activities, they'll say, oh, I've never been able to do guided meditation, like my mind wanders and goes wherever. There's something about the bilateral stimulation that they'll actually end up coming back and saying, like, that was the first time I've ever been able to like focus on something. Like it actually like made me stick with what we were doing. And I like that dual awareness seems to work really, really well for them.
And I think this has come up in a couple of different ways, but um, is it possible that your client has a memory come up that was not remembered or blocked before doing EMDR, and now it's come up? And how do you handle it when that situation?
Yeah. Yep, that happens. And I've had that happen, multiple times. And again, I'll give you like kind of classic example. I have a client that I'd worked with for years doing EMDR. She loves EMDR and lots of complex trauma. We'd been working together for a couple of years. She ended up having an incident that she had never remembered come up in the middle of an EMDR session about being sexually assaulted as a kid. And as the clinician, I was like, oh crap, but probably said other words, right? And I'm like, oh, what am I going to do? And so anyways, we did like a safety plan. We put it in the container, which we're going to learn. I'm like, what do we want to do with this? She was distressed. I got her back in that same week, which I would recommend. That was part of it. So she came in a few days later and I said, okay, what are we going to do? Do you want to process this like on its own? And she said that, that she'd wanted to process it. So we set up this protocol, which you're all going to see around going in to kind of like do some work on that. And she ended up coming to the realization that she's like, I don't really want to know the details of what happened. Like I was able to see that this occurred, but like it's not important for me anymore to explore. But going back to that question, it could be different for every client. So you might have to do your own like trauma work that might get added to the timeline. We might have to kind of target that individually, but it is important to just safety plan like you do with anyone. That's why the resourcing element is so important. And keep in mind that like our memories, we have like a max capacity for what we can store. So typically it's common when you start doing EMDR and things are getting moved or reprocessed, maybe some new things will come up that maybe you haven't thought of for a while, or maybe it was a repressed memory. When that does occur, give the client the choice of what they want to do with that and try to get them back in, keep a point of contact with them.
And this is another one that's been asked by a few people, but what do you do if you're looking to provide EMDR to a client who's kind of in an ongoing traumatic environment, where emotional safety just isn't available to them?
Mm-hmm. Yeah. I mean, so common, unfortunately, for those of us that have worked with adolescents and kids too, or even in those domestic violence experiences, right? And one thing that I think is important is don't discount the work that we do in session. So I always just want to make sure like those resourcing skills can be huge. Those might end up becoming the survival tools that they hold on to that allow them to get through that. And maybe those are skills that they end up getting to turn to instead of turning to like substances or whatever else it can be. And sometimes you can help them process some of those things, and it can still like show them that even though like their environment's not changing, that at some point they still have hope for the future. So I'm still a proponent of moving forward as long as that's safe.
And probably the last one for this round, it is a book recommendation question. So get your pens out quick. They want to know, what book, Megan, would you recommend for someone who's entirely new to EMDR and they want to learn more? What are the great books that are available to them?
Yeah, there's a couple that I like. I mean, obviously, okay, so if you can handle like textbook and you want to just like nerd out like me, I love Francine Shapiro's just eye movement desensitization and reprocessing. I think it's honestly wonderful. I think it's great. And yeah, that one's probably my favorite. If you're like, I don't really like those kind of books, then I would recommend, this is probably one of my favorites by her, Getting Past Your Past by Francine Shapiro. And it's made for people that are like, what, maybe going to be clients and want to understand EMDR. It has some good, like, kind of for the lay person or like the lay reader, right? About what EMDR is, what trauma is, and then some of those resourcing skills. And then I love anything by Laura Parnell. So the Clinician's Guide to EMDR by Laura Parnell is one of my favorites. And anything else by her, I would highly recommend as well.
Okay. We'll end this session with that. Megan, if you do want to take some more questions before the day wraps, just call me back on screen and I'll come on once more if you need me.
Maybe do that. I'll maybe do that before we wrap up today. Okay, thanks, Ryan. Good news, you guys. We have one more hour left. So thanks for staying on, those of you that have been tuned in all day. I really appreciate it. We've got an hour left of this. I'm going to teach you a couple good resourcing skills. We're going to go through some of the bilateral components. And then tomorrow we're going to get to see what an actual like EMDR processing session looks like when we're really targeting a specific trauma and how we're going to utilize that. And don't worry, I will not forget to create resources for you guys to put in that Google Drive. I will add those book recommendations on there too, just in case you missed them in the chat. So let's talk about these different methods of bilateral stimulation and what we can use and what this looks like. So obviously we know that EMDR was initially centered around eye movements. And there's a couple of things to keep in mind. The demo that we're going to see tomorrow morning, the first one, is going to be of a really good EMDR session that's done by another clinician. And it's a really good straightforward look at what basic EMDR is. And you're going to see the use of eye movements in that. I always think it's important to show this so that you can see what that setup looks like. So you're going to see kind of that just traditional style of EMDR using eye movements. Now, if you do choose to use eye movements, a couple things to keep in mind is if you're doing these in person, so with clients in the office, we wanted to set up what we call this ships in the night kind of orientation. So we never sit directly in front of the client. So I might be sitting here and my client would be kind of parallel to me. So you're like ships in the night that could pass each other and they would be just like maybe directly in front of me, a safe distance, right, that they feel comfortable with. And we can use eye movements old school way with fingers where we're just moving them back and forth. And what we're looking for is we want the eyes to track my fingers. So in resourcing skills like restoration team, we want these to be just a little bit slower, not too slow. I don't want them like this. We want them just a nice cadence and a nice rhythm. And I want them to just follow my fingers. I'm watching for their eye movements to be able to track my fingers. And if I notice that their eyes, like let's say my fingers are over here and their eyes are jumping ahead, that means I need to usually speed up those movements. You've also seen in office, I'm sure some of you that are familiar with this, what they call like the light bar or the light board. To me, it looks like a music stand typically, or it's on a music stand, you can put them on there. And it's just kind of like a board, or it reminds me of like a light bright where you can see like different kind of colors that would move like dots across the screen. You can do different designs, like it'll have like a figure 8, it can go diagonal, and you're just having them watch that. And again, you're watching the eyes. And again, I usually will set that off to the side of them if we're going to be using that. And then if we're going to be using eye movements virtually, I'm going to show you a couple different options for that. I'm going to show you the most easy one to probably go to. So just for user-friendly sake, we're going to start here. This is called bilateralstimulation.io. It's free. There is an upgraded one that you can utilize. I am going to drop this in the chat and Maddie can share it with you guys. Because as we practice maybe some of these other resourcing activities that we're going to close the day out with today, you might want to try maybe the eye movements or the sound. So going back to this one, what this looks like is if you go here and let's say, so obviously we're the therapist. I might put my name in or maybe the first name of the client. And then what we'll see is it'll pull up this screen for us. And like I said, there's upgrades that you can do, and you can invite a client. So if you do that, you click on this, it'll give you a link. You can like send it to the client and they can utilize this. Sometimes what I'll do, and I'm going to show you this really quickly. So this is what the client will see. So if you want to test this out when we're learning like some of these resourcing skills, the last couple that we're going to learn today, just come to this, set it up as the therapist, put your name in, and then click down on the bottom. You're going to click preview down here what the client sees. And you can use this for yourself as a way to gauge maybe how you would use eye movements here. And this might, okay. So this is what the client would see, just this on their end. They wouldn't see the rest. And we would just click on Start BLS. Obviously it's lagging with my internet, but if you follow your own link, it will go at your internet speed. You can speed it up down here, and then you can stop it. You can change the color of this as well. So you can use this if you want to try this during the next couple exercises instead of the tapping. Some people really like the eye movement, so go ahead and try that. Find like a speed that you're just easily able to track for the resourcing activities that we're doing. So we want this to just be enough that it's not too disruptive, but that it's just providing kind of that external stimulation. So that is what I will tell you about the eye movements. One thing to keep in mind with eye movements that you do need to be cautious of and screen for is keep in mind that if they have any history of seizures, any history of sometimes migraines as well as one that I've been seeing, and like epilepsy or anything like that, or epileptic seizures, don't do eye movements. It has been found to trigger that, so use a different form of bilateral stimulation. So just keep that in mind. One thing I do see a lot with eye movements is sometimes what will happen is clients will like kind of dissociate when they do eye movements. And this is something that can happen. So it'll be like they're just tracking the eye movements, but there's no thought progression happening. They're kind of just like spaced out. So if that occurs, then we likely either need to speed up the eye movements or we need to try a different form of bilateral stimulation. One thing I will say that I like about the eye movements as well is if you get someone that's a talker, because EMDR, you process quietly. So there isn't verbalization taking place, just like what you guys experienced, how I asked you to think on those things. That's exactly what I would do in the office. I want the client to be silent during that time. So when they're adding the bilateral stimulation, they're not talking out loud. That actually slows the processing down. So if you get someone that wants to overly talk, switch to eye movements. It will be harder for them to talk. It'll force them to kind of just track and think. So sometimes that can be good for more kind of like logical, over analytical people. Sometimes that can help with their processing as well. Those are kind of the caveats I'd tell you, and limitations for eye movements to keep in mind. And you're going to see a demonstration of that tomorrow. Kind of first thing, we'll see a demonstration with eye movements in person that will be helpful for you guys. Another thing that I like on this website as well is you can change the position on here of where things might be moving. So center, and if you do, I think like sign up for the extended versions, you can move at all these different angles. There's a couple other online platforms for this that are similar to this that you can use as well. They also have an auditory feature. So if you turn on the auditory, because that's the one that we're going to look at next, one of the ones that I like is the heartbeat. So maybe they just want to do sound and not eye movements. I might not even share this with them and ask them to just listen to this. I have to turn mine up. I don't know if you guys can hear that. Mine's being quiet on my end. Normally you can hear it. So it'll be like a heartbeat sound. I'm not sure if that's coming through on your end, but for some reason it's not on mine. Okay, so those are some of our just the eye movements to keep in mind. You'll kind of see what that's going to look like. Like I said, tomorrow we're going to look at some other ways that you can utilize sound for bilateral stimulation. So on here it gives you some different ones. I'd tell you to play around with this. Maybe you want to try the sound. The heartbeat one is one of my favorites on here. There's also like a finger snapping, soft bell. And then some people actually really like more sound with it. And what we're looking for with auditory is I want to make sure that we have headphones that they can utilize. And I want a clear delineation from right to left. So I want to make sure that they aren't headphones that are just going to play sound on one side. I want it to make sure that there is some rotation. I'll see if this will play on here for us. This is one that a lot of my clients like as well. But again, I want this with headphones. And I'll send a link for each of these ones I like. This is another one that I like as well. This is the other one that some people will use. There's too much going on in this one for me personally, but some people like this a little bit more. I'm going to show you one other one that is quite good. Let me search. This last one that I show you is great because if you go to their actual channel, they have different speeds of sound on there. So this would be one of the really slow resource ones. So the higher the BPM, the quicker it will be. So this one would be 50, I'll show you. I'll show you this one for faster. So this channel is great for just keeping it really like for different pulses if you're trying to find something if they do like sound. Recommend this as well. Also, I'm going to put a couple links. There's a couple different playlists that have just bilateral sound for EMDR on Spotify that I also like quite a bit that I'll recommend for you that I'll put in that resources document for you all. And then I'll talk about a couple of these. So sound, same thing. We just want that rotation from ear to ear with headphones if you can. These are some other ones I recommend that you can look at as well. Then we get back into the actual tapping that we tried. So we have the butterfly hug, tapping on your legs. You can do the safe havening if you want. And if you're in office, you can also use the TheraTappers. I don't know if anyone has seen those, but they're just like little square nodes. My favorites are what they call BiTaps. And BiTaps, they're Bluetooth enabled. And most of the, if you end up getting like the light board, they'll usually have an additive to have like the TheraTappers, and all they do is vibrate or pulse. And you can set the how strong the pulse is, how quick it pulses, and so you just have them hold them in their hands and rotate from side to side. Kids love the TheraTappers that way. And again, like I said, the BiTaps are my favorite. They're Bluetooth enabled. You can just hook them up to your phone, and they work really well. So that's another tactile stimulation one that you can use. With kids, obviously, there's different bilateral techniques you use, like patty cake, marching. You can do things like drumming. I use a magic wand sometimes, scribbling. You can be really creative. Anna Gomez uses the gorilla. So like you beat your chest like a gorilla, and the butterfly hug. So you can be really creative with what you're going to use for that bilateral stimulation. I'll tell you too, what I use a lot in my office is I will put a TV tray between myself and the client, and those that I'm comfortable with or that are comfortable with this element, I have them lay their hands flat and I tap on top of their hands. While their hands lay there, the tray kind of creates like a barrier between us, creating kind of that distance. I think that that physical touch component is a huge healing process. And actually, most clients that have tried other mechanisms usually come back to that, as it really is like creates an external stimulation that sometimes they're not in charge of, which helps. Again, use that with clients that you feel comfortable with. If you feel like, there's some that you obviously don't do it, but I think it creates like it's amazing for what it does with healthy and safe attachment and touch. If you watch some of the really well-known clinicians within the EMDR field, like Laura Parnell and various others, they'll get like in your business, like knee to knee, and tap on the outsides of the knees or on top of the legs. So that physical touch component can also work as well. Most of the time, if we're in a virtual space like this and a client's going to use tapping, I always will co-tap, just because I want them to feel like there's a sense of presence. But these will give you some other options that you can check out on this slide. And then I really practice congruent breathing with this. So we're always going to use like a set of bilateral stimulation. We're going to breathe in, breathe out, and I'm always going to try to mimic the breath of the client. That congruent breathing is important. And this dual awareness, that bilateral stimulation, is really being enhanced when we add that congruent breathing, or when I do kind of that congruent tapping with them. And so what most of the resourcing activities are going to look like are going to be similar to what we saw with restoration team, where we might talk and come up with something, and then we'll add the bilateral stimulation, and then we'll stop and check in where there's no bilateral stimulation. So anytime we're talking to the client and the client's sharing with us, there is no bilateral stimulation. So I'd encourage you all, especially those of you that haven't used EMDR before or ever experienced it as a client yourself, try out a couple different forms of the BLS options and see which one kind of works best for you. Everyone processes or likes things, likes to process in a different way with a different form of external stimulation. So use what works best for you. You might have to try out a couple different things. You also might have to do this with clients, just to see what they have a tendency to respond the best to. So keep that in mind as we practice some of these different forms of bilateral stimulation. Try that and see what works best. Also, just remind them that this is really going to help keep them kind of grounded and present in the moment. The goal of adding this bilateral stimulation is to kind of just keep them here in the present moment and not getting kind of carried away too far into whatever they're experiencing. It adds that dual awareness, but it also is going to help pull those logical pieces of the brain into perspective so that they can either enhance something like a positive resource, or they can filter through something that they need to let go of. Okay, so we're gonna go into learning our next resourcing activity. This one's like the hallmark resourcing skill of EMDR. And calm place is very common. This is like one of the have-tos within EMDR treatment in this preparation phase. So we're still in that phase 2 of preparation. And usually my go-to resourcing skills are, I like calm place, container, and restoration team. We're going to do all 3 of those. I have a couple others that I like as well that I'll sometimes integrate, but these are kind of the go-to, and these are the ones that I feel like are necessary for clients to have. And if they're unable to do these, I do not move forward with EMDR until they're able to successfully do these skills. So this one will feel similar to restoration team. There'll be a little bit of a difference, but it'll feel kind of like a guided meditation a little bit. The only difference is you're adding some form of bilateral stimulation. So I'm going to ask you all to kind of just, again, you will get a handout with this that walks you through what to do step by step. And I want to just encourage you to find the form of bilateral stimulation that's going to work best for you. So if you want to try out one of the other ones, you can. You'll just see me kind of co-tapping. So whatever form of bilateral stimulation you're using, you're going to do that until I tell you to stop and I'll prompt you when to start that. So with calm place, the goal of this activity is to think of a place, real or imagined, a place you've been or haven't been, that would just kind of represent tranquility, calmness. They used to call this a safe place. I, like a lot of others, hate the word safe place, because a lot of clients are like, there isn't a place that's been safe or felt safe. So it's just a peaceful, calm, tranquil place, be a happy place, whatever they want to call it. But just something that would represent feelings of positivity. And I don't want it to be a place where anything negative's happened. So like if you pick childhood bedroom, but there was lots of like trauma and chaos going on in the home, then I might gently say, I want us to pick a place that is just free from anything negative or bad that has ever happened. Like I don't even want it to be associated. So this might be someplace they've always wanted to go, but they haven't been. Common to be like the beach or something like that. That's scenic, but it can be anything. Again, doesn't have to be a place that they've really been. Just a place they've wanted to go, a place that would feel calm. So kind of think for yourselves what comes up as you think of a calm, peaceful, tranquil place. And I usually will check in if I'm doing this with a client, say what's coming up, just to make sure and screen that it's an appropriate place that doesn't have anything negative associated with it. And then this is where we're going to start. So I'll say I'm going to walk you through kind of this it'll feel like guided meditation, where we're just going to enhance the sensation of this place. So I'm going to ask you to add your bilateral stimulation. While we do this, I'll prompt you when I want you to stop. So I'm going to invite us all to go ahead and find that bilateral stimulation. Go ahead, take a deep breath in with me. We'll let that go. Go ahead, start those taps or whatever form of bilateral stimulation you're using, and you're going to continue with this until I tell you to stop. And with eyes open or closed, whatever you prefer, continuing that bilateral stimulation, I just want you to bring up this place, this calm, tranquil, peaceful, or happy place that you thought of. I want you to notice everything that you can see in this place. So notice the colors, the objects, the details of the scenery. Even notice if anyone's with you. You might even notice the time of day, if it's night, morning, mid-afternoon. And I want you to notice everything you can smell in this place. So notice if there's any of those specific scents or distinct smells that you notice. And notice anything that you can hear. What sounds come to mind as you imagine being in this place? Notice if you're eating or drinking anything in this place. And then notice what you're physically doing in this place. Are you walking, sitting, standing? Notice the temperature of this place, if it's warm or cool, if there's a breeze. And just notice the way that you feel emotionally and physically as you imagine being in this place. Go ahead, we're going to take a deep breath in. We're going to let that go. Go ahead, stop that bilateral stimulation if you haven't already. And typically if I'm working with a client, this is where I'd ask them, I want you to just tell me what came up. What did you notice? Describe what you envisioned or what you imagine. So I'm looking for them to kind of tell me about their place. I'm also kind of screening as I ask this for any intrusions that might have come up. So were there any barriers that came up? So for example, it might have been like, yeah, I was thinking of calm place. It was on the beach. It was nice. And then all of a sudden I felt like kind of this dark, like shadow or something show up. So I'm going to have to deal with those intrusions if that occurs. So if that did occur for anyone, this time I want you to think about maybe removing that from your place. So you can either put it somewhere else and then come back to your place. You can also think of creating like a protective bubble or wall around your place if you had any of those intrusions come up. Or you can imagine a new place that would maybe be free of any of those lingering things. Or you can just notice. Totally up to you. So we're going to go back into the second part of this in just a second. Before we do, I want you to think of kind of like a mantra or a statement or a word that would represent this place for you. So it can be something like, and typically I want these to be like an I am statement. So like, I can be calm, I'm safe, I can handle this. Whatever is kind of like positive that you want to remember that maybe this place reminds you of or could be associated with. You just come up with one word like peace or whatever, that's fine too. So go ahead, we're going to take another deep breath in. We're going to let that go. Go ahead, close those eyes and start that bilateral stimulation again. And we're going to continue with this once more until I tell you to stop. And bring up that calm place again. I want you to just bring in the details of your surroundings, everything that you can see. Notice what stands out. Notice the vivid colors, the objects. Notice the sounds and everything that you can hear in this place. Notice any of those distinct smells. or different scents. Notice if you're eating or drinking anything. And notice what it physically feels like in this place. The temperature. Notice what you're physically doing. As you kind of bring up all these sensory details, I just want you to imagine what it feels like kind of just being in this place, even if it's just imaginal. And as you do, I want you to hold whatever that mantra is that you want to be associated with this place. Just kind of hold that mantra with the image and the feelings of this place. And I want you to start with just imagining the feelings and sensations of this place. If you can imagine them starting and running through the top of your head, flowing down into your neck and shoulders, down into your arms, hands and fingers, back up into your chest, down into your gut and stomach, into your hips, legs, and into your feet and toes. And just hold kind of the peacefulness and the calmness of this place along with that mantra. Go ahead and take a deep breath in when you're ready. Let that go. Go ahead and stop those taps if you haven't already. And then just kind of notice what came up for you. It's okay if you got distracted. It's okay if your mind wandered. These are all things that are normal and can happen. Just be observant of them. Again, if you had intrusions come up, I might encourage you to pick a different place. Those of you that maybe struggle with visualizing things, keep in mind that a way that an additive to this that can be helpful or a modification, you can pull up like an actual picture. So sometimes I might ask them to pull a picture up on their phone and I'll have them look at it while they add their bilateral stimulation and think about each of those sensory details. You can even do this with a picture of a place they want to be. That works very nicely as well. And if there were maybe further intrusions that came in and I'm working with a client, right, they said there was still this shadow or I was doing good, but then like I had kind of these intrusive thoughts or images pop in. I would work with them on what those were, finding a place we could put those, finding out what they want to do with those, if this place was related to anything disruptive. So this is Calm Place. This is one of the hallmark EMDR resourcing skills. I never ever move forward unless they can do this skill. And to me, I want this one and restoration team and container before I ever move forward. So keep that in mind. But we want a calm, grounded, regulated place. This is a place that we're going to use. Like if processing gets overwhelming, when we start to target trauma, we're going to come back to the calm place for a moment, get them grounded, recentered, and then go back into some of our trauma work. We can open and close sessions with this. Also love this one in groups as a mindfulness activity. And then the last one that we're going to learn today, we're going to kind of go right into this one, is what we call container. I personally like container more than Calm Place. I just think it's more useful and I really like it and like the creativity with it. Okay, so kind of same context, but this time we're going to be coming up with a container or an object that we could safely and easily store things into. It can be extremely imaginal. I'll give you a lot of different options for this. It doesn't have to be something you have. It can be if you want. And you can be really creative with this. So some examples of a container could be like a mason jar. Maybe it's multiple mason jars. It could be a Tupperware container. It could be a gun safe. It could be a chest. I've had people do everything from like coffins to like the bottom of the ocean and a treasure chest. So you can be very creative with this. Just has to have some way to open and close and stay somewhat concealed. And same thing, we're going to add some bilateral stimulation with this one. So I'm going to invite you all again to find kind of that form of bilateral stimulation that you're going to do. And first, we're going to start with just bringing up this image of this container. We're just going to get it more vivid in our mind. And then I'm going to lead you through what we're going to do with it from there. So everyone, again, use whatever form of bilateral stimulation that you want to use. Go ahead. We're going to take a deep breath in. We're going to let that go. Go ahead, eyes closed. If you prefer, go ahead and start that bilateral stimulation once more. And I want you to start with just envisioning or bringing to mind whatever container or object comes up for you. It could just be something that you could easily put things into, but just needs to have a way that you can secure it and keep it closed to some degree. Once you bring up that object or you have something in mind, I want you to just notice what it's made out of. Notice the size of this object. You might even notice if it's expandable. Maybe you would need multiple of these containers. You might even notice if it's soundproof once things are inside. Notice the texture that it would have. And then notice the way that you'd open it and close it. And how would you keep it secure? So maybe there's a lock with it, or a key, or a passcode. Or maybe it's even kept in a place or a room with a lock. Just notice how you'll kind of keep that contained and secure. Go ahead, take a deep breath in for me. Let that go. Go ahead, stop those taps or bilateral stimulation for a moment. Now we're going to switch gears for a minute. So now I want you to think about a recent kind of annoyance, frustration, or stressor that's been taking place in your life recently. So don't pick like major big traumas right now. Just pick something like that's been recently kind of coming up, causing some stress, frustration, tension. And we're going to bring this up in a minute as we add our bilateral stimulation, and then we're going to envision putting this inside the container. Okay? So everyone, go ahead, take a deep breath in. We'll let that go. Go ahead, start that bilateral stimulation for me and continue with it. Eyes open or closed, whatever you prefer. And bring up that container, that object once more. And just kind of notice it. And I want you to just imagine, if you could, kind of opening this container, this object. And after you open it, I want you to envision putting any of those stressors, annoyances, frustrations that you were just thinking of. I want you to imagine that you get to place them in the container. If they feel too big for the container, you can expand it, come up with a new container. You can shrink it down to fit in the container. And I want you to come up with few of those stressors or annoyances and just imagine kind of placing them inside that container. You might notice if there's anything that's kind of hard to get inside the container, or things that maybe you're struggling to put inside the container. And if anything like that comes up, maybe just see if there's anyone from that restoration team that could maybe help you put these things or these objects inside this container. And once you've envisioned kind of putting those stressors in the container, I want you to imagine closing the container, sealing it, securing it, locking it. Maybe it's even placing it on a shelf or putting it somewhere. And just know that these are things that are just going to be safely stored until we're ready to come back to them and give them the time and attention that they deserve. So that for now, we're just moving them out of our mind's eye until we're ready to address them. And they're safely stored here. You can even just imagine like walking away from the container. You're leaving it in a room, maybe closing the door. And just distance yourself from that a little bit. Notice how that feels to leave some of those things there. Go ahead, take a deep breath in for me. And let that go. Go ahead, stop that bilateral stimulation if you haven't already. And then kind of just notice what came up. So I know I'm going to get probably a ton of questions around this. That's okay. Very common. So notice, was it easy to put things in? Was it difficult? I always get asked about this. Isn't this kind of dissociative? And the goal is that I'm always going to make a list as the clinician of what we've put in the container. Now, small, like menial things, maybe we don't need to go back to, but those bigger things that need, like I said, that time and attention to be addressed, I am going to always make sure that I go back to those. And then we would kind of go through the same steps. Imagine opening up that container, taking out this issue that we're going to be dealing with today, and then putting that lid back on, and then we can focus on this issue. So it's just kind of a nice way to get some separation, but also some focus on working at things one at a time. It also oftentimes creates a sense of safety, that those triggers or traumas aren't just floating around, that they're in a secure, safe place. So I always want to know what clients put in the container. This is used a lot if we're working on like trauma processing and some new trauma comes up, right? Like someone, they remember something in the middle of processing, like we talked about. This might be where I say, okay, we're going to pause for a moment. And I want us, like, can we take this and put this in the container so that we can come back to it and give it the time and attention that it really truly deserves? Because I don't want to abandon whatever trauma that we were working on to now address this, but I want to make sure that there's compassion with those things that come up. So very useful that way, to kind of having the client imagine putting that in a safe place. Again, I always want to check in with what the clients have put in the container. And this is also a really great way to end incomplete sessions, to envision putting disruptive things in there as needed. So these are kind of those 3 hallmark resourcing skills that we're going to use at this stage in EMDR in this preparation phase. And you're going to see why these are really important when you watch some of the demos, or we get into kind of the trauma processing piece of EMDR tomorrow. So I'm going to stop for a moment because I'm sure that there's a lot of questions, and I know that we've only got just a little bit of time left. So I want to make sure that I go and answer as many questions as I can for you guys. So bring Ryan back in.
Here I am. Question 1 that seems to come up a lot right now is just about, you're going to have an additional bunch of resources. And I think folks just need to hang for tomorrow, and then you'll either have a link that you'll share with them where they can grab those, or we'll upload them into the portal. So for those of you waiting on kind of that set of additional references and exercises, it's coming. Incentivize be back with us tomorrow. So tune back in, and you'll get those. And we'll try to get through lots of end of the day questions. So we're going to go right into them. Megan, can we do these resourcing activities with clients in any order? Is there an order to these?
No, I like to pick the ones, do which one you feel like they're going to have the most success at first, I guess, right? So to me, it's like try them out. It's trial and error, see what works for them. So no, I'm okay with you just trusting that gut level instinct as a clinician.
Okay, good. And I think some folks maybe need the Megan advice of keep it simple, but there's lots of tapping questions. Again, like does it have to be the butterfly hug? Can they tap elsewhere to facilitate bilateral stimulation? They have to do it a certain way.
Yeah, and again, like feel free, you guys, you can be creative just like we are with kids with bilateral stimulation. Like I talked about the marching or the scribbling or whatever it is. Ariel Schwartz talks about using the safe havening a lot. And so you can be really creative with that. You don't have to do the butterfly hug. If you want to tap on your legs, I have some people that will just tap fingers like this, or tap their feet. Like do what works for you and what you feel like is best. Like you can be creative with that piece. We're just looking for that stimulation from right to left side.
And there was a couple of people asked this, but do clients ever put people in the container?
Oh yeah.
Okay.
I'm like every day, you guys, I put people in the container. Just kidding. Yeah, oftentimes you can put people in the container or you'll have that come up. Sometimes that can be honestly more helpful. I had someone a couple of weeks ago that they had like a whole bunch of like Tupperware containers, and then they decided to make like a padded cell for someone that they're like, I don't want to put them in the Tupperware. That feels mean. So I'll make like a comfortable space for them, but I can't hear them. So yeah, totally okay there.
And someone's talking about attachment focused EMDR. I'm just curious, how is this different than just EMDR?
Well, really, I think all EMDR is really attachment focused EMDR. It's just how we call it. But honestly, like really good fundamental, like good EMDR work incorporates attachment based like notions with it. So like restoration team, totally attachment based kind of theory, right? A lot of the parts work that you do with internal family systems, it's very similar. What you'll see tomorrow in the first demonstration will be like, here's generic EMDR that doesn't look at attachment based theory. And then you'll see kind of in my demo the difference because I use a big attachment based background with EMDR and I think it's more effective.
Perfect. More on that tomorrow. Question on the train or the movie activity. How long do you let them watch the movie or ride the train, and are you prompting them, as they're doing this?
Yeah, and all this we'll talk about tomorrow because this is kind of what we're doing when we get into the actual trauma processing. So that part will kind of make sense. So hang on to that question because you'll see we do kind of these sets, and that's when we're kind of prompting them to watch the movie, and then we give them breaks. And you'll see what that looks like tomorrow, but I'll touch back on that for you guys then.
And here's someone wanted to know, EMDR ever used in couples therapy, for instance, when trauma or attachment wounds from relationships would have brought them to therapy?
Yeah, actually, one of my very favorite EMDR resourcing activities actually comes from the framework of an attachment based kind of resourcing skill that they use with parents and kids. And I use it a ton with couples. And it's amazing at restoring like secure attachment. And it's just a really cool like intervention to use. It's something I use with couples a lot. And I can talk about that tomorrow more too if you guys are curious what that looks like, because it's honestly a good skill to me that doesn't require like knowing the whole logistics of EMDR, but can be a really safe way to create like some secure, safe attachment with a parent and child or with partners.
And then we've got a lot of folks who work with kids, and said that's kind of a focus for you in the past. But folks are wondering, so when you're working with like elementary aged kids, how do you ensure that they're the ones taking the lead in EMDR therapy?
Oh, kids like to be in lead. So they actually like the freedom to explore. So a lot of the times you give like the option for like integrating sand tray. So when they have like they get to create the calm place in the container. They get to create or make, maybe you make your own container, right? So you can integrate all those different like artistic creative ways where they get to be in the lead without having to use as much like verbal language as sometimes we require them to. So that's one thing that I like. Kids will typically need maybe more prompting, but they will do well with it. And you spend a lot of time just resourcing with kids, like using a lot of these resourcing skills to kind of teach early emotional regulation.
And somebody just looking for what you do in therapy outside of EMDR. So no IFS was a big one, but what modalities does Megan love when she's working with clients?
Yeah, I love IFS. IFS is probably like close to EMDR for me as a big love. Love a lot of like polyvagal stuff and somatic work, like a lot of attachment based theory, like emotionally focused therapy. Those are probably my top ones. Oh, you're muted.
It was going to happen at some.
It's okay.
This one came up a number of times. People who are working with individuals with traumatic brain injury, and
Mm-hmm.
what do you do there? Is this concerns with using
Yeah.
EMDR with that population?
Great question. Always consult with their neurologist on this. Let them know that you're doing EMDR. You want to get information on, and if the neurologist is comfortable with it. Most neurologists are pretty familiar with what EMDR is. I think a lot of it is you have to have considerations of where the TBI occurred. So you know what kind of limitations and barriers that you're going to run into. And it's also going to tell you a lot about the way that they might process. So for example, if maybe there was impairment, right, to a lot of the like right hemisphere, maybe there you're going to have more like logical or abstract kind of things, and it will be less emotional. Just depends, but you really want to consult with the neurologist on that. And to me, it depends on the severity of the TBI, but still some of the resourcing activities can still be helpful and beneficial, but just use with caution.
And we've had a number of people who work with first responders. So not something specific, but just tips. I work with first responders. I'm looking at EMDR. Give me the tips.
Oh, love first responder work with EMDR. I actually think it's one of the ways you get them to process. A lot of first responders are taught to live and kind of have to be in a hyper arousal state, right, in order to be on guard and to respond the way that they need to. EMDR can do great work with this. I mean, a lot of where we've seen EMDR come in strongly is after things like 9/11, Sandy Hook, these like big mass incidences. Even the Vegas shooting, like we'll pull in like crisis responders that do EMDR that work specifically with not just the victims, but first responders that are there. And a lot of the times, first responders like the freedom of not having to talk about things, but just getting to have control over what they experience. And there's some really good articles and resources that are specific to first responders pertaining to EMDR.
And then maybe two more as we're getting close to the end.
Okay.
Bilateral stimulation outside of session. Folks asking about the benefits of this outside of the therapy room, something they can use on their own.
Yeah, I like them to use it on their own, especially with like any of those ones we learned today. So maybe it's like you have them practice calm place before they go to bed and they're just laying in bed and, doing their tapping or tapping their fingers under their desk or whatever it is. It can be a good grounding technique for them to utilize. And a lot of people will say that just the tapping alone is really beneficial.
And the last one for today, lots of questions again, as this is kind of this introductory thing. People want to know more. How long should someone train before they start practicing EMDR with clients? Are there any kind of factors that they should consider, in terms of a clinician's level of readiness to go actually use this tool?
Good question. And if you guys are curious about that, I would recommend going over to Evergreen certifications and checking out just the training and certification process within EMDR. And you can look at EMDRIA as well. We have very similar standards to that. But what you're going to find is that typical training, like I mentioned, is about 5 full days of training. And then and during that time, you're being required to practice the skills. You're being observed practicing those skills. You're being taught a lot of the specifics about EMDR and those limitations and risks. And then you're required to do ongoing kind of consultation. You have about 10 hours of that you do. And so to me, you have to practice it to use it. EMDR is a skill that you can't just be taught. You have to be willing to experience it yourself and to practice it and to also have that client experience. And if you're not willing to do that, EMDR is probably not the right tool for you to use. But typically it's about 5 days. We encourage you to kind of start practicing those early resourcing skills after the first 3 days of training. And then we're consulting with you on those. And then you slowly kind of integrate using the other skills.
I think that's it. Is class dismissed?
Class is dismissed. So have a good night, and I will see you guys tomorrow morning. Thank you so much. And I look forward to not seeing you, but you guys being here tomorrow. So have a good night.
Morning. Once again, thank you for tuning in. Ryan Bartholomew Pesce. Day 2 of an EMDR training with Megan Boardman. We're ready for a great second day. Hope you are as well. So go ahead and grab your coffee, settle in. If you're at home, get the dog or cat to scooch over. And remember, we can't see you, so you don't need to tidy up. You don't need to make your bed. You can get comfortable. And remember to keep the great questions coming at the www.pesce.com/askmegan. But before we get going, there's kind of the things to know. So here's today's archive access to the recordings is going to be available usually within 48 hours. An archive tab pops up in the course portal, so you can go back and watch those videos. Check the chat for updates on break times, if you need CE, those kind of things. And plus, the much awaited link to the additional resources that Megan's put together is waiting for you in there now. I think it's also being added to your portal, so you could download it there as well. If you purchased live CE credit for this at the end of the event today, go into the live event tab in your portal, press the click here to obtain your CE certificate button. That's where you're going to complete your quiz, complete your evaluation, and then you can download your live CE certificate. If you're having technical or CE questions, you can also go over to that FAQ tab. There's some info there. And please feel free to connect with me on LinkedIn. A lot of you already did that yesterday. Sent me an invite. I really appreciate that. So I thought I'd put it out there. Always love it when you guys reach out and kind of tell me in a direct way what it is you think Pesce should be doing next, or what's missing and you need. Maybe you think Megan should do some other stuff. Let me know that, and then I can hit her up for that. We'll make more stuff along the lines of this. So also, if you've been inspired by a trainer like Megan and you have something important to share with the community, let me know that. So maybe you want to get into doing this stuff on your own a little bit. We can talk about that too. So look me up. I'm easy to find. The picture on the account is ancient, but it is me. So it vaguely will look like me from a decade ago. But really, that's it for me for now. I just wanted to thank you for choosing Pesce. I'm going to see you at the Q&A sessions. And Megan, I'm just going to turn them over to you.
Hey, thank you. Want to welcome everyone back. Those of you that were able to come back and attend live on both days, welcome. Also, I started that Google Drive link for you. You'll have it in your Pesce Drive. They're going to make it on a document as well so that you'll have access to that. But just know I'm a big advocate for sharing resources. So I leave access to that Google Drive open forever until like Google Drive is not a thing. So you'll always have access to that. I will be adding a few more things that I just didn't get to adding yet. So you might notice on the resource list document that there's still some things that aren't quite on there. Don't worry, I am going to be adding those. So I'll add that tuning in exercise. I'll also be adding some more resources for childhood EMDR, explaining EMDR to kids and what that looks like. And then I will be adding some of those telehealth resources along with links to different bilateral stimulation resources as well. So if there's anything else on there that you're like, hey, we learned this and I really wanted information on this, just let Maddie or Ryan know and I'll make sure that I add it. And you should have already seen the documents on there that kind of walk you through how to do Complace container and restoration team and some other good, and the timeline is on there as well. So I will continue to add through that throughout the day, especially as we maybe talk about and add a few more things. So just look for that to continue to change. And if there's anything else I can put on there that we've covered that you didn't see, just let them know and I'm happy to add that and share that with you. So I want to give you kind of the rundown for today. So we're going to do just a quick overview of those 8 phases one more time, kind of just summarizing where we left off yesterday. Then we're going to get into the part that I know everyone's kind of been interested to hear. So what does this look like when we start to actually process trauma? So we're going to look at that, how to set that up in EMDR, what that looks like. This is the part that I do recommend, like this is more advanced skill set. And in order to do kind of this next part, I do recommend more training. But you will get a feel to see if it's something you would even want to use. You'll get to see 2 demonstrations of this, and they're very different types. So I always think that that's a good kind of way to see just everything that you can do with EMDR and what that can look like will be helpful for you as well. I am going to show you a couple of videos. One this morning that is like an intro to this is what it looks like for kids. And we're going to do another resourcing activity together and go from there. So I'm excited to have everyone back. Thank you. And I wanted to say thank you to everyone that had reached out on social media and had sent emails and just all of the kind words and inquiries. I really do appreciate, and I appreciate you guys taking time to be here. So with that being said, we're going to jump over to, I'm going to show you guys 2 different videos for kids if we're explaining like what this looks like. So I know that there was a lot of questions yesterday about, okay, what does EMDR look like with kids? Can it be done? Yes. And so I wanted to just show sometimes in those early psychoeducation phases, just some of the resources you have to show or explain to family or kids what this looks like that are a really nice addition. And I will add both of these for you, but they're just a couple minutes long. So we're going to start with that, and then we will jump back into where we left off yesterday. So let me... So ironically, there is this International Association of EMDR that's actually in the UK, and the organization in the UK posts all of these wonderful videos for kids, and they're honestly really great for explaining trauma and all of that. So we're going to watch 2 of these, and then we will get back into our content.
Sometimes bad things happen. When they do, the brain stops working in the way it normally does.
The bad memories can get in the way of things we want to do.
We might try to lock the memories away,
But they're always there, never leaving us alone. No matter how hard we try to ignore them.
these memories may make us feel sad,
Scared.
Or angry all the time.
Many people try to hide away from the memories and pretend that they didn't happen.
Whatever the problem, there are people who can help.
EMDR is one way of sorting out the bad memories.
It can help take the bits of bad memories
And build them into something more helpful.
making you feel better.
Making you feel better.
Making you feel better.
Right? Like, how cute is that video? Also, I think it's such a simplistic way of explaining EMDR, even if we're working with adults. So sometimes those memories get stuck and they create blocks. And even when we try to avoid them, they're always still there, right? And EMDR is taking those bits and building them into something new. So love this one. I'm going to show you one other one that's really great. So give me just a second to pull it up.
Ever since that night.
Okay, I'm going to show you, we're going to do two because I forgot that this is a good one and I do want you guys to see this one. So this is a depiction for a way you could use as a resource for explaining to adults. So if you remember yesterday, we watched the one from the VA that just briefly explained EMDR. I am going to show you one other one for explaining it to EMDR, and then we'll go to the children's one. And don't worry, they're only like 2 minutes, 2.5 minutes long each. So let me pull this up. And especially as we're getting ready to move into this phase, this will be a good introduction for you guys as well, but also shows you maybe how you can introduce this to clients.
I just can't face going out.
I've-
That night, I just can't face going out.
I've always had a nagging sense of being a failure, of not being good enough.
My childhood was a mess. I was abused in so many ways.
I had a phobia of dogs. I avoided places where I might see them, which became a real problem.
I was so full of shame. I just felt dirty, and there was no way I could trust anyone, not even my friends.
I've tried different therapies since I was a teenager. Some made me feel a bit better at the time, but the depression kept coming back.
I would lose whole days disconnected from the world, or feeling like I was living in a fog.
If I saw a dog, I was terrified. I would literally shake, and that would make me annoyed, as I knew it was irrational.
Everyone told me I should deal with it and move on, but the thought of telling anyone and talking about it filled me with dread. EMDR therapy gave me hope that I can put that night behind me.
I had EMDR therapy. The first sessions helped me understand that the way I thought about myself was a result of past experiences.
EMDR therapy helped me to process some of the horrendous things from my past.
As we worked through old memories related to my phobia, it was like my fear button started to get switched off.
My therapist told me that it was a recommended treatment by the NHS and World Health Organization for trauma. Also, that I didn't have to go into all the details, which was a relief.
As we worked through different memories, it was like my head and gut finally started to see things the same.
We went very gently to begin because I was all over the place. But step by step, I started to feel a bit better.
When I went outside, suddenly I wasn't scanning around for danger. I'd kind of forgotten what that was like.
As I processed what happened to me that night, the images became less vivid. The shame dropped away, and I could see for the first time it really wasn't my fault.
That belief of I'm not good enough slowly started to crumble. And I realized I am okay. I'm as good as the next person.
With EMDR, I started to leave the past behind.
I began managing situations differently, and I felt the old me coming back.
I'm Lindsay. EMDR therapy allowed me to move on.
I'm Dave. My EMDR gave me hope.
I'm Suzanne. EMDR has given me back my life.
I'm Mike. EMDR therapy was my path to freedom.
So I'll tell you really quickly about one of my success stories with EMDR. And it's actually, I have an EMDR workbook that comes out in the spring, and it's actually, my workbook is dedicated to this client in particular. So I started seeing Jordan several years ago. When she came in, she was in her mid-20s. She was brought in by her husband. She had 4 children at the time, and twins, and then 2 other little kids under the age of 5. She had extreme complex trauma. She had never been to therapy before. She'd witnessed dad try to kill mom. Dad and mom were heavily involved in drugs all of her childhood. She had a younger brother, and they had not just, mom and dad's friends and using buddies coming in and out of the home, but there was also a lot of prostitution going on in and out of the house as well. Lots of neglect and physical and emotional abuse. And when I first started seeing her, she couldn't stay the night alone. They were eventually taken into state's custody by the time she was a teenager and placed with another family member. She had never been able to be on her own. She'd never been able to stay alone or work full time. She had quit at the time, going to college, and was just having constant panic attacks, anxiety. And so the husband basically said, you need to go in and get therapy, because he was wanting to go on a hunting trip, just debilitating anxiety, fear, panic, all of these things. And kind of one of those clients that you guys could probably all relate to, that you get and you're like, ooh, I really hope that we can do something, right? But it's like maybe you question yourself, if you're like me, of I hope that there's enough I can give this person that I could make a difference. Or sometimes it's hard for us to see that change, right? It could maybe be possible if they've lived this way for so long. So anyways, she starts coming in, and she did good with talk therapy, but it was like we could talk, and it was like, how you can feel they're talking about it, but it's like there's just still something there that continues to get in the way. So we started doing EMDR, and over the course of a couple of years, that we would do EMDR about once every other week, probably for about the first year pretty consistently, and then it would go down to maybe about once a month after the first year. Anyways, she, over the course of her sessions, and she was someone that her husband and her kids were on a restoration team, but there hadn't been anyone else. So there was a lot of fictional people on there. And over the course of these EMDR sessions, she would, it was so weird. She would have this, and this will make sense as we get in today, but she would have these different images at the end of each EMDR session, where she'd say, it's so weird, but this time I see like the shield of Wonder Woman, and it's on the floor. And then we do another session, and she'd say, it's so weird, like this time I'm just seeing like the head garment of like Wonder Woman. She's like, I don't even like Wonder Woman. I don't even know why this is coming up, right? It's weird. And over the course of these like 2 years, she would collect like these different pieces of Wonder Woman's costume. And it there was a point where she ended up saying that she realized why she had all of these, and she was able to put them all on, these like, the armor of Wonder Woman or whatever, which she had done all on her own. But one of the most powerful things that she shared with me is, she was the one I told you guys about yesterday. She had an incident of sexual abuse that she had forgotten about, that had come up, and just so much childhood trauma. But one of the most powerful sessions that we ever did, she was talking to me about, and she hated resourcing at first, so this was actually funny. We struggled for a while to be able to do Complace, or she liked Container, but there were some other things that were hard for her and took time. And so after that memory had popped up, we had done some work on some other childhood memories, and she shared something with me that I'm going to share with you all really quickly, and then I'll tell you about it. That just was it's really powerful and just shows you what EMDR is capable of doing. So she told me that she had this done for her after we had done a particular EMDR session. And in this particular session, we were working on some childhood trauma. And one of the interventions that I had her do is I really struggle with sometimes when I go back and work on childhood trauma, it's really hard for me to say to them, okay, now that we've worked on the childhood trauma, we're just going to move forward. And so it's nice that we resolved that childhood trauma. And so one of the interventions that I like to use is anytime that we're working on earlier incidences of abuse or childhood trauma, I use this very common directive where once we kind of get it resolved, I say, I want you to now take this child and you're going to put the child somewhere where she gets to be a kid. Like, just imagine this, like you as a kid. So it can be in your Complace. It can be, you can bring her with you. You can put her somewhere where she gets to just be safe. Like, she doesn't have to stay in the memory of what was tainted. And so what was funny to both of us and ironic about this particular kind of incident is she had always kind of resisted with Complace. And she ended up taking her daughter, her child self, she told me, and I'm going to share this picture with you. Can you guys see? Yeah, you should be able to see this. So she ended up telling me that she had imagined, right, we're doing this, and says, I'm in this place, it's like a field, and there's all these wildflowers, and I'm sitting there with my husband and my kids, and I'm imagining myself as a child being there just playing with my kids, not having to bear the burden of all the abuse and everything that had gone on. And she describes this like vividly to me, right? And then she ended up sending me a picture of this, and she had this image of her Complace professionally painted and hangs in their living room. And I want to tell you where she's at today, because she's one of those ones that I just was questioning if we would ever get here, right? Like, what would be their best level of achievement? And she is now back in school to get her social work degree. She's the director of our Children's Advocate Center for the Court System. She has gone on trips by herself. She's been able to stay by herself, and it has completely transformed her life. And I've seen, I could tell you dozens of stories like this, but this one's near and dear to my heart just because of the EMDR bond, I guess, that we have. But I wanted to share this with you because to me, it's a reminder that change and hope are always possible, even when we get those clients that might feel difficult to make progress with. So I'm going to go back to sharing just this one last child video with you, and then we will get back into where we left off yesterday. So let me pull this up.
Hi, I'm Charlie.
Hi, I'm Majinda.
Hi, I'm Sam. I'm in the car with my nan. I hate cars. I want to feel safe again.
I hate talking about what happened.
My foster parents are trying to find ways to stop my nightmares. I don't tell my nan how I feel because it makes her sad.
Mum has taken me to see someone who she thinks can help.
I feel very alone and miss my family.
My therapist says I don't have to talk about the bad things that happened.
Mum told my counsellor what happened because I couldn't say it.
With my doctor, we played games and did drawings.
We thought about the times I felt brave and strong.
We drew a special place that made me feel happy and safe.
When I'm with her, she asks me to draw pictures of what happened.
He said he could help me sort out my hard feelings.
I want to feel like it's not my fault.
She taught me how to make a butterfly with my hands and imagine it giving me a hug.
It seems weird, but he moves his fingers left and right in front of my eyes, and it helps my mind do the work itself.
We wrote a story about a girl who had the same bad things happen to her.
After each picture, we used these hand buzzers. It felt nice.
It was hard to follow his fingers at first, but then I started noticing things changing.
When I listen to the story, I sit on Mum's lap and she taps my shoulders.
Sometimes I just scribble my pictures out.
I remember things, but I don't get upset anymore.
The story helped me think I was a good person and it wasn't my fault what happened.
In the end, I drew a big picture of me being president when I grow up.
I notice feelings inside me, but after a while they don't seem so bad.
I felt better after the story. Together we added some more stuff which felt right.
I still miss my family, but I am happier living with my foster carers.
Now my hard feelings have gone and my memory feels better.
The bad things still happened, but when I think about them, they don't bother me anymore.
I can now remember some of the good times I had with my family.
It's like my brain has sorted itself out. EMDR helped me feel safe again.
EMDR helped me feel good about myself.
EMDR helped me find my good memories again.
And like I said, I will put all of these links for you in that resource document, the additional resources, later today or when we take that first break. So let's get back into our slides, but hopefully those gave you some additional kind of feels for what we can do with EMDR, how we can at least explain that. So if you remember yesterday, we kind of left off with developing some of these resourcing skills. We started with restoration team, which you should see a document in that link for the directives on that. And then we moved into ComPlace and container. And if we go back to remembering that EMDR is based on this 8-phase model, and we covered a lot of phase 1 and phase 2 of what that looks like. So it's preparation, it's history taking, it's psychoeducation on trauma and EMDR. And then really the most important part of this during this kind of preparation phase before we get into what we're going to see next is really making sure that we have resourced our clients well. And remember, in EMDR, resource just is a fancy word for coping skills, so that we've provided them with enough coping skills and resources to make sure that they're going to be prepared for when we get into the trauma processing, that they're going to be able to handle whatever comes up, because EMDR does have this free association kind of element to it. The mind is going to go wherever it goes, and you're going to find that EMDR, everyone processes differently. To me, EMDR is kind of like you go into a maze together and you don't know which direction it might go, but you kind of have to learn how to navigate that with the client. So you have to be prepared for, like the example I gave yesterday, maybe it's a memory that popped up that they weren't aware of. Maybe you run into some blocks that you need to learn how to navigate. So the more resources that you can give them that they have shown that they're able to utilize and that work for them, the better that's going to be. And again, that disclaimer is I'm never going to move forward in the process until that has been, those goals have been fulfilled with developing those resources. So we're going to start with one of my favorite exercises. This one is one of my personal ones that I developed, but I love it for kind of preparing people to go into the next phase of EMDR. I'm going to walk you through this one. I call this one the path. And I think this is a really nice skill to kind of prepare people for tackling maybe what lies ahead, what giving them strength, and helping them kind of just put that perspective of how far they've actually come. So we're going to walk through this one together as a resource skill. I will put this one on the drive for you later today. And then we're going to get into phase 3 of the assessment of how we set up an EMDR session. So again, just allow yourself, please, to have this opportunity. We don't get that very often as clinicians, in trainings especially. So just let yourself kind of immerse yourself in this experience. You'll have all the directives and everything needed. Don't worry about taking notes. And just notice what comes up for you. And it's okay if it doesn't go perfectly. That's real life and real world. Just be curious about things that do come up. If there's blocks or barriers that maybe some of you run into, know that that's okay as well. That happens. That doesn't mean that you did anything wrong. There isn't a right or a wrong way to do any of these exercises. Just be curious about what it's telling you or what it's teaching you. You can use whatever form of bilateral stimulation that you want to use. So if you want to go to that bilateralstimulation.io for the eye movements, which I can have Maddie put in the chat for you. So it's just that bilateralstimulation.io. You can use that for the eye movement piece. If you want to use any of the auditory, you can just go to that YouTube and do EMDR bilateral sound. I will upload some of those referrals for some or references for some of the ones that I like, or you can just do the tapping with me if you want. If all those things feel too disruptive and you just want to use it as a guided meditation, feel free to do that as well. So just let yourself go wherever you go on this. So let's all go ahead. We're going to take a deep breath in together and let that go. And when you're ready with eyes closed, I want you to go ahead and just start that bilateral stimulation for me. And as you do, I want you to bring to mind a path, a road, or a trailhead. And it can be any path, any road, or any trail, one you've been on or haven't been on. And as you bring your mind to this, I just want you to notice, kind of take in your surroundings. Notice everything that you can see, the colors, the details of your surroundings. You can even notice the smell, maybe if anyone or anything is with you. And then I want you to be curious about looking up ahead or down the road or trail. And just notice what lies ahead and how you feel about this trail or this road. Maybe some of you are already on the path or trail, and just kind of notice where you're at on that trail. If you're towards the beginning, somewhere in the middle. I also want you to be curious about where the trail, the road, or the path, where does it lead? And how will you know when you've kind of arrived at the final destination? Where will that take you? And then I want you to just notice, are there any barriers, difficult parts that you're anticipating on this journey or trail or path? And what kind of resources are you going to need to help you get through that? So maybe it's water, maybe it's snacks, maybe it's the right hiking shoes. You can even think about how long it will take you to get to the end. Is there anything that's going to help prepare you for this journey? Just notice. Go ahead, we're going to take a deep breath in. And let that go. Go ahead and stop that bilateral stimulation if you haven't already. And this is normally, if I'm working with a client, this is where I would say, so tell me about your path or your trail. And they might describe it to me, right? And it's going to be different for all of us that just did this. And that's okay. Keep that in mind. And now we're going to go back in. So after they've kind of described it to me, and I'm just making sure, again, as the clinician, we're touching base. We're seeing if they were able to kind of envision that or go with that. And now we're going to go into the second part of this exercise. So I want you to go ahead. We're going to take one more deep breath in. Let that go. Go ahead. Start that bilateral stimulation. We're going to continue with that once more. And with eyes closed or open, whatever you prefer, I want you to bring that path, that trail, or that road back up again. So just notice again, take in the surroundings. Notice where you are on this path, where it leads. Notice how you feel about being on the path. This time I want you to envision that the path or the trail actually represents your life path. What changes? I want you to notice or imagine, where are you at on your own life journey or your own life path? Somewhere in the middle, closer to the end. And I want you to take a moment, and we're going to just turn wherever you're at in the path, and I want you to turn and look back to where you started. So where you started this life journey. And I want you to see everything that you've had to overcome, all the barriers, the steps that you've had to take, the things that you've had to endure. I want you to notice just how much you've overcome and how far you've actually gotten. Maybe even noticing that you're farther than you realized. And as you kind of look back and you reflect on where you started, I want you to notice or observe, what have you learned? What's been vital for you along the way? What's allowed you to get to where you are today, even if it's not where you want to be? What's allowed you just to get this far? And then I want you to turn, and I want you to now face where you're headed. And just notice what lies ahead. It could be multiple options. Maybe you have multiple trailheads that you get to choose now to take. Notice what or where the path leads to as you look ahead. Where are you trying to go? What are you hoping to achieve or attain? And I want you to notice how much closer maybe you are to where you want to be than compared to where you started. And you might even notice, what are the specific resources or things that you need to hold on to or remember. It's going to help you kind of continue on this journey ahead. Maybe it's people, maybe it's insight, maybe it's certain skills or tools. Just notice how it feels to be where you're at on the path, but how does it also feel looking ahead? What does you hope for? And if you want, you can even imagine kind of arriving wherever you want to arrive at, getting to a place that feels where you want to be. Just see yourself being there, remembering how far you've already come. Go ahead, we're going to take a deep breath in now. Let that go. Go ahead and stop that bilateral stimulation if you haven't already. Now, if you didn't learn this yesterday, you likely learned this with this exercise right now for a lot of you. This one can trigger a lot of emotions, totally normal. In EMDR, you learn to become really comfortable with emotions and feelings. So know that it's common for this one to bring up emotions. And I'm going to talk about a couple different things that maybe some of you experienced. So some of you might have had the experience where that was nice. It was nice to see just how far you've come. It was nice to be able to say, I actually have overcome a lot, and I'm so much closer to where I want to be in life than where I started. That might have been an experience for some of you. Some of you might have been like, oh, it was kind of nice to have that perspective that I kind of always feel like I'm still at the beginning of the path, but it was nice to realize that I'm actually not, that I've actually gotten farther than I think. Maybe you don't know where you're still headed. Maybe some of you just like to have the options to choose, that you could go down whatever path, that there's opportunities or unbeknownst things that are waiting there, also okay. Maybe some of you have brought up some grief over some of those things that you've had to overcome. And acknowledging those, maybe for the first time giving yourself permission to just say, yeah, those things have been hard. This is how far that we've actually gotten. Putting that into perspective. Okay, if that happens. And maybe some of you, there's emotion about not knowing where you want to go next. Or maybe it's fear about the future or fear about what maybe lies ahead. That's okay too. And if that happened, usually I would take us back in and we'd find a place, a resting spot along the way that we just want to stop and rest. That feels comfortable. Sometimes we don't always have to just be going somewhere. That's okay too. And then maybe some of you had maybe that grief of wanting to be farther than you actually are. Also okay. But just know that whatever came up for you, whatever came up is right for you, has a meaning, has a purpose. But our goal with this is I like to use this as a preparation skill of, I want them to see just how far that they've come, right? I want you to all see that experience of, I've come so much farther than I realized or that we give ourselves credit for. And sometimes, kind of like the movie theater or the train analogy that we talked about yesterday, this can be a nice one for them to look back and put the perspective of, okay, I can address this trauma because I've actually gotten to this spot. And sometimes it can give them the resolve to say, yeah, we can do a session and get through this, right? We can do one session and process through this. And maybe it will give us a skill that's going to help us along that journey even further. So that one, like I said, is one of my very favorites. Super interesting always to see what comes up along that journey. And I know some of you, normally when I'm in trainings, I'll have people kind of explain or share what comes up, because I think one of the ways that we learn best when we're doing work like this is when we get to hear kind of like the different perspectives, right, of what comes up. So I'm going to share a couple different for you that'll give you kind of some ideas of maybe what a client might come up with. So I was doing a training a couple weeks ago, and I had a lady in the EMDR training. She's doing the certification that she shared. She was on a path, and it was a path that her and her husband walk, and it's kind of a big circle, and it starts at their house and it leads back to their house, and they take their dogs and how that felt safe. And so she envisioned this. She saw how she's been able to confidently develop these, her husband and her dogs as resources, and how that's felt good in life to have them, to finally have people to depend on, to be able to go out and kind of see what's all there. And she sees kind of that things either circle back, but one of the things that came up for her is that her pathway ends up back at her house, and that the house represents safety, and it represents the people that she loves, right? And just the sense of security. And she ended up getting really emotional while we were doing this. And so when I checked in with her, she said their house had just flooded, And so even though we were talking about the path, she said it felt like there was nowhere safe for her to land. So when she was trying to think about where to go, it was like safety and security had been rocked, right? And so there was some disruption in this exercise. And so we ended up going, like I had her imagine taking the things in the house, like the dogs, her son, and her husband, and going to somewhere that felt safe and secure again, that where it wasn't intruding on those things in the house, like the flooding. And she was able to work through that. So that's an example of one thing that can come up. I'll give you an example of another one that this one is actually my own personal path of the very first time that I was walking through and kind of developing what I wanted to do with this exercise. So with mine, and it's so funny what your mind will come up with, right? I imagined like Mount Everest, and that my path feels like it's on the journey to Mount Everest. And when I envisioned, stopped, and looking back, I could look back and I could see that I had overcome like the ice falls. Anyone that's a hiker familiar with that, you know that the ice falls are the most treacherous spot between Camp 1 and Camp 2 on the hike to Everest. And that I was able to overcome that. I had come past the ice falls, but there were still these other checkpoints along the way. I'd been able to do it. And for whatever reason, I'd envisioned that I'm at like the last camp and it's like a blizzard. And I actually got stuck myself here for quite a while, where I could see people that I cared about that were there. They weren't hiking with me, but they were along the sides of me. And I'm struggling. I'm slipping all over. I have my ice picks. And I'm thinking, I just can't get to the top. I can't get to where I want to be. It always feels like a struggle, right? And I had envisioned my higher power kind of behind me. And he's kind of like, whatever, do your thing, right? And he's there. And then I had kind of been stuck a couple times here where I couldn't just envision getting up there. And then finally, I had kind of just had this thought with myself of, well, how could I ask for help? I have all this gear, but why am I trying to do this by myself? And when you climb Everest, right, you have to kind of depend on if you're with other people at times to help you. And so I thought of this higher power instead getting in front of me and helping be the guide that I can follow instead of me always trying to blaze my own path. And then I was able to use the tools more effectively. And when I got to the top, I could see all these lights and I could just see opportunity and endless places that I could go. But that at the top, I could see more clearly instead of getting stuck in the storms of life. So you could have anything come up on this. I've heard just about everything. So that could be realistic, totally imaginary. Just know that either way this comes up, what we're looking for is we want to utilize this as a resource to prepare them for where we're going next. So with that said, we're going to get into this third phase of EMDR. And I am going to go back really quick and just show you where we're at on these phases. Okay, so we went through phase 1 yesterday. We went through phase 2. If you remember, I talked about we kind of do phase 1 and phase 2 together. And those are usually like intertangled. So a lot of the times you're taking the history, but also teaching the skills and the regulation skills. Again, and I'm going to continue to stress this as many times as possible, I never move forward until I have spent a lot of time resourcing. So this doesn't mean, oh, cool, they did complex container and restoration team, we're good to move forward. I want to make sure that's worked at least, and I've had a session in between after teaching them that where they're telling me that, yeah, those skills have worked, they've come back, we've been able to do it again. And I really want to stress, when you find skills that work for a client, sometimes we get in that therapy kind of mode of we can check the box, right? Where it's like, it worked. And then we want to find another skill that works. stick with what works, because the more you can teach them to use it, and you can teach the repetition of every session. Maybe we do Complace, every session we do container or restoration team or whatever other skills that you might use. You're teaching them how to turn to that as a resource. We want to make that a new habitual skill for them. So just remember, continue to use what works and you'll have more success, and you're going to have less barriers when you get into this phase that we're going to go into. So if you remember yesterday, I said EMDR is based on an 8-phase model, and that sometimes the 8 phases are even a little bit confusing for me. Now I understand them, but I find when I'm training that the 8 phases kind of feel confusing, and you're going to see why here in a moment. So phase 1 and 2, very clear. Phase 3 is even really clear. Phases 4 through kind of 6 is where it's a little bit like, kind of feels like one phase, but it's not, and we'll talk about that. So we're going to look at phase 3, this assessment phase. And this phase 3, so essentially this is what I'll tell you, phases 3 through 7 are done in one session. And this is why it's confusing to me a little bit, right? So 3 through 7 is what an actual EMDR processing session looks like. So you do these, this would be like an actual trauma processing session. Again, once a client's been resourced, they're ready to kind of start targeting things. So 3 through 7 is an actual session, which we're going to see some examples of today. And so we're going to get into looking at this phase 3, this assessment phase. And this is where we're setting up what we're going to be targeting in EMDR. We're going to do this every single time that we go into trauma processing. So anytime that we're going to work and really target trauma in a session, we're going to be using this assessment. A lot of people, and myself included, call this the protocol. So this is the EMDR protocol. I follow this every time that I do a session, especially a reprocessing session. So let me pause and we're going to jump back to where we were. And a couple things that we're going to stress really fast, again, that I want to just review that we touched on yesterday. Remember that I said EMDR is going to be very different than talk therapy. So this isn't us analyzing what's coming up for them. This isn't us giving them our perspective of what's coming up. With EMDR, again, you're that compassionate companion on this journey with them. You can be the guide when they need you to be. Most of the time, they're going to be kind of the guide. You're going to allow this free association to happen. And we're really going to stress in this next phase that the client's job is just to notice what's coming up. So wherever their brain goes, even if they're thinking like, this is weird, this is stupid, I tell them that's normal, right? Or they're thinking about the cars driving by or grocery list, whatever it is. I just want them to notice where their brain goes. And then that's all they need to do is just allow themselves to kind of trail off or go wherever the mind wants to go. And going back to, again, we all have this natural healing process, that adaptive resolution process in our brain. The bilateral stimulation is helping us to access that. And so allowing the brain to kind of filter to where it needs to go, even if it feels completely unrelated, there's usually a meaning and a purpose for why the mind is going to where it needs to go. It's filtering through things. Maybe it's also telling us what blocks we're running into. This is all normal, but really their job is just to notice what comes up. And then when we check in as the clinician, I just need them to give me an idea of what's coming up. So even if it's weird, stupid, they're blocked, nothing, what they tell me, and sometimes I say the more that they tell me, and I don't need all the details, but the more they tell me of the gist of what's coming up, the more I can help them get unstuck or help the processing proceed. But again, their job is just to really notice, and they're in control of that. As the clinician, my job is to make sure that they've been resourced, and I have to really trust the client. I have to trust in their ability to heal. I have to trust in their adaptive resolution system. It's there, I promise, even if it feels like it might not be. And you're gonna hear this a lot with an EMDR. Trust the process, right? But remember that we're on this kind of journey with them together. So we're not dictating what comes up. I might help redirect when needed, but we're not asking why they think something comes up. So you have to learn with EMDR how to really take on a different therapeutic approach, because it's going to be very different than that psychoanalytical process that sometimes we find ourselves in. And then I'm going to jump back into where we kind of are going to go with this next. Oh, and let me just kind of rephrase this. So some different resourcing options you can use. So you can do Complace. Icons, I'll tell you what those are just really briefly. Icons are, maybe you didn't do restoration team, an icon might be just like a hero or someone that they've emulated, that they've looked up to, if they struggle to maybe come up with some of those restorative figures. So kind of like just someone they've emulated that's kind of hero. We've got Container. You can even do just a resourcing activity where you have them envision just their future ideal self. The future template we'll talk about later, but this is essentially where you have them envision kind of reacting or responding the way that they want to respond to future anticipated threats. We can also use that movie theater analogy to create some safe distancing if they get really dysregulated. So reminding them just to observe it on the screen. Do they want to fast forward? Do they want to stop? Or with the train. Wheel of Fortune is one where we come up with different resources. And it's one that I'll actually add to the drive for you. It's another way to access maybe some additional resources. We talked about that restoration team, and another one that I like to utilize is what I call the inner advisor. So if they had an inner advisor inside, what would this inner advisor tell them to do? I want this to be like a positive inner advisor. Now in this phase 3, this assessment phase, and again, this is where we don't start using this protocol, and what you're going to see, this protocol, what you're going to see kind of done here, this is where you need additional training, because you're going to find and see in the demonstrations that you see today, and as I kind of describe this, that so many different things can come up that you really need to know how to handle those from an EMDR perspective. So we're going to look at this assessment phase today, just so you know what it would look like if you started to use EMDR. This is where we kind of move to, and this is part of that process. So I'm going to pull up the protocol sheet that I use, and essentially we're targeting 8 specific things when we get into this phase 3. Oops, sorry, give me just a new share here. So this EMDR protocol, this is what we're going to use at the beginning of every session. And remembering again that we're staying out of the way here. So one thing that this is intended to do when we get to this phase 3, is these 8 questions. To me, I think about it this way. So this is like getting an X-ray view or a snapshot of how this is being stored for the client. And what's more important is how it's being stored than why it's being stored the way that it is. We already know the why is because there's something here that's been maladaptively stored as traumatic. The client likely knows that too. So we're not getting into like analyzing why this is an issue. Why do they think this? What does it, all of that. We're not doing that. So we really stay out of the way when we set this up. So we literally follow this. And I know a lot of people, clinicians will say, it just feels so like, formulated. And it does. And clients will get used to it. But it's important because for us to access that neural network of trauma that has become stuck, we have to kind of stir it up and activate it the way that it's being stored for the client. So not the way that we perceive it, but the way that it is for the client. That's going to allow us to get in and be able to access those little neural pieces that are kind of causing those barriers and issues. So think of this as like this X-ray view of what and how this is being stored for the client. And literally you use about this much information, like you don't need more than this to write. And I'm going to show you, this is one of kind of the nice things about EMDR that I also think clients end up appreciating, because they're used to being asked all these questions, right? Details about what occurred. So the very first question that we start with, and again, this protocol is 8 questions total. And I can typically set this up in like 5 to 10 minutes. So this can be very like brief. I'm not wanting to spend a lot of time here because again, a lot of what we're going to be doing is where we're going to add the bilateral stimulation next. So we typically just want to set this up first 5 to 10 minutes and then move into the next phase. But again, this is giving us that picture of what we're going to try to resolve. This is also how we're kind of treatment planning. So it's giving us a goal and it's giving us something that we're working towards, which we're going to look at. So we're going to start with, okay, what are we targeting today? What's the presenting issue? So what are they wanting to focus on today? It can be an issue, a memory. And I'll give you an example of one that I just did. Let me pull it up on my notes. This will be helpful for you guys. Beautiful session. Okay, so this can be one of the things, if you remember to what I said yesterday, that one of the things I appreciate about EMDR is you don't even have to start with the trauma, and you're going to learn this today. This is one of the things I like about it. It's like a sneaky therapeutic way to get them to sometimes deal with the trauma without maybe necessarily naming it that, and getting them to shut down right from the beginning. So sometimes what we might target here is whatever the crisis of the week is, right? They come in, here's the issue, and this can be just what's going on this week. So I'll give you an example of one that I just recently did. So this presenting issue for this client was she is having a block in moving forward with her business and fear of feeling rejected and feeling less than if she moves forward. And that's all I need to know. So I don't need to say, why is there a block? What are you feeling blocked about? Again, it's just what she wants to tell me. This can literally be like 1 to 2 sentences. The one thing that I will ask is if I'm working on something that's like past. So let's say she's like, I wanted to target a car accident that I was in. I would want to know, okay, when did this happen? Because that's going to tell us about those fragmentations that occur, the emotional maybe blocks or the emotional age that we might run into of things that we need to be considerate of. So again, very brief here. So block and moving forward with the business. She said fear of rejection and feeling less than. And then we're going to ask, what's the worst part? So when they bring this up, what part feels the most intense or stands out the most to them? And this is where they really will tend to get, this is where the activation kind of lies, right? And this can be an image. So maybe it's an image of, if we're using the car crash example, it could be that image of seeing the taillights get closer and closer, or the headlights getting closer and closer in the rearview mirror. It could be a sound. It could be whatever just stands out the most. So for this client, she said her worst part was that she's going to have to reach out to everyone because it's been 9 years and there's this fear that they all hate me, will shame me, or will all go talk about me. So for her, she said, she described it kind of as like an image. It's reaching out to everyone and this image in my mind of them rejecting this idea or shaming me for kind of being off the business scene for as long as I have. So that's the worst part. So we're wanting the part that stands out the most intense part. And then we move into what we call the negative cognition. And keep in mind, yesterday I noted this, but EMDR, they love acronyms. And so you might see the negative cognition maybe somewhere in your slide listed as the NC for that negative cognition. And so now we're going to ask them, what's the negative belief? So when they bring up this incident, so the car accident and the worst part of seeing those headlights get closer, as they think about that now, so it's now looking back, as they think about that now, as they bring that up, what's the belief that it leaves them with? And this is where I give the list of negative and positive cognitions. And so I'll give them this list, and I want this negative statement to be an I am statement, because this is the way that they're internalizing this experience. And it can be anything on this list. The bold categories are telling us more about clinically, kind of like, okay, it was about they're feeling responsible, or they feel like they had a loss of control. And I'll show you in my office the way that I use this. I printed the negative and positive cognitions. I have the negative on one side, the positive on the other, and I have it laminated, and then I just give this to them. If we're in office, if we're doing this on Zoom, I literally just share screen like you're seeing is done right here. So I'm going to ask them, again, when they bring up that car accident, when they imagine seeing like those headlights getting closer, that worst part, as they think about that now, so it's now looking back, what is the belief that it still triggers or brings up for them? So maybe it's I'm in danger or I'm not safe. For the client that I was sharing with you all about, she said, I'm not good enough and I will fail. So it's common that sometimes they'll pick multiple negative cognitions. That's okay. I want the one that kind of like one or two that stand out the most. Like which one kind of fits best or is the strongest as you think about this? Now I get to ask this question a lot as well. Are you sure it's okay to give them the list of cognitions? Doesn't that bring up a lot of negative internal stuff? And my belief is this: the negative internal is already there. We've been avoiding it for long enough. So to me, also from a kind of neurobiology standpoint, if you think back to, we talked about that inhibition, if I'm already getting them somewhat kind of a little bit triggered, right? But they're still in that window of tolerance. I know that that Broca region of the brain that allows us to put words to experiences is also inhibited. And I want to make sure that I get how this is being stored accurately. So I give them this list to help them find the words that fit best with their experience. So I ask them to find that negative cognition, the NC. So it's now looking back. And then this is kind of our goal. So our treatment goal becomes the PC, or the positive cognition. So as they think about this car accident they were in and that worst part of those headlights they could see getting closer, what do they wish they could feel? So it's, even though this happened, what do they wish they could feel or believe about themselves that's going to really help them get past this? That it's like, if I believed this, I could be over this finally. And this is where I will share that positive cognition list. And it doesn't have to be the opposite. Oftentimes it's not, which is interesting. And usually they'll pick like a handful of these positive ones. Again, narrow it down to like the one that it's like, yeah, this is the one that I really, if I could believe this, I would really feel like I could overcome this. So for my client example, she gave that I'm significant and important. That's what she wants to believe. So we've taken the negative, now looking back, the beliefs it still brings up for them, what they want to believe, even though this happened. And then we're going to take our first weird EMDR rating scale, and we call this the VOC, or the VOC. And this VOC is the validity of cognition. So it's essentially how true the positive feels. So we already know the negative's true, or it wouldn't be an issue, right? So it's how true does this positive cognition feel to them now? So as they bring up this incident that we're targeting, how true does this positive belief feel to them? And this is rated on a scale of 1 to 7. Weird scale, I know. And 1 is completely false and 7 is completely true. So 1 being completely false, 7 being completely true. As they bring this up now, as they're thinking about all this, how true does it feel to them? The positive cognition. So we could say, okay, that as you think about this car accident now, as you think about seeing those headlights coming in and still that idea that you're in danger, how true does it feel that you're safe? That I am safe now. And 1 being false, 7 being true. As we think about the incident right now. And usually it'll be like anywhere between like a 2 and a 4. Sometimes they'll be like, oh, it's a 7. I know that I'm safe now. So if that happens, then we'll say something like, okay, so if we fully believe we're safe now, then maybe why do you feel like this is still an issue? So is there something else that you are feeling like maybe you don't believe that's keeping you stuck with this memory? So maybe we would go back to the positive cognition list. And then I'll address this because I know I'll get questions. Why is it 1 to 7? I don't know. I genuinely believe that Shapiro made it 1 to 7 because we have 2 different rating scales. And I believe it's just the way that she differentiates them so that the clients don't get confused. So to separate them out, because 1 you're scaling and moving up, and the other one you're going to see it starts high and you try to move it down. Either way, if you wanted to change like 1 to 10, that's totally fine. We mainly just want to rate, this is going to be a checkpoint for us as the clinician. We're wanting to rate how true it is, and that's what we're going to be looking for as we get into processing. We're looking for this to increase in how strongly the client believes this. So that's called that VOC, or the VOCs. So it's how true the positive cognition feels to them as they bring this up. Then we're going to rate what are the emotions that come up. So as they think about, and I'll tell you, let me go back really fast since we're doing this example. So the positive cognition for my client, she said she wanted to feel significant and important. As she thought about putting herself back out there in this new business venture, how true does it feel that she's significant and important? She rated that as a 2. And then we're going to say what emotions come up. So as we bring up this initial incident of, putting yourself back out there in the business, this block moving forward with the business, feeling less than, what are the emotions that are coming up right now? And this one, I say, do not ask anything else as a clinician. Stay out of the way. Because again, this is just their perception of how it's being stored. So even if I know there's like 15 other emotions that they're not listing, those emotions are going to come up for them when we get into the processing. And it's not about what I think, it's about the client's experience. They'll feel and experience those when we get into processing. So this is just us seeing the lens of how they're seeing it, which is more important than my interpretation. So what are the emotions that come up when she thinks about this? This client, she said, I feel sick and tearful. And most of the times they've given you other emotions. So like in hers, like in when she said the block and moving forward with the business, she said there's fear of rejection, feeling less than. I've kind of noted that as a clinician, but I do think it's interesting when you ask this emotions question that they'll identify typically either a lot of emotions or it'll be like one or two. That's okay. So again, staying out of the way, not asking what else is there or why those emotions. We don't ask any follow-up questions. And then we're going to ask about body sensations. So as they bring up, this incident that we're targeting, so the car accident, as they bring this up and they start to think about it, where do they start to feel it in their body? And for the client that I was using as an example, she has really good somatic awareness, but she said she feels it in her solar plexus region, that it feels black and kind of bleak. She feels it across her chest and like it's connected to her breathing and like her breathing is being stretched out and restricted, the back of the neck. And then she even described it feels like there's two arteries running down the back of her neck, like there's a thick substance that's being pulled down and creating kind of this cold effect. Sometimes they'll just say things like, in my stomach. This is the one place that, because of that disconnection that occurs, this is the one place that I will just ask, I want them to just describe the sensations to me. So if they say, I notice it in my stomach, I'll say, tell me about what you notice in your stomach. Describe that for me. They say, I notice it in my chest. Same thing. Describe that for me. What are you noticing there? And that's it, because we're just kind of trying to get that body and the brain kind of connected and in sync. And then we're going to ask this final question. We call this the SUD, the SUD. This is the subjective unit of disturbance, basically the disturbance level. So on a scale of 0 to 10, where 0 is no disturbance and 10 is the most disturbance they could have, how disturbing does this feel to them as we talk about it now? So not when it happened, but now as we think about it. And this client, she said it was a 10 as we were talking about it, that it was triggering a lot of anxiety. Sometimes I'll notice that they'll rate this one lower than it actually is. Again, doesn't really matter because I know that it's going to get to where that it needs to go when we get there. But again, this is just about their perception. So really quick, those are just like those 8 questions that we're going to get into. And this is how we're going to set up every session. We're not asking follow-up on any of the questions. We're literally just gathering the information. We're getting it as kind of a snapshot. And this is telling us, again, how that's being stored in those neural networks. It's telling us why there's some of those barriers or issues that are there and how this is getting in the way. So once we've set this up, then we move into phase 4. So one thing I want to say about this, as you're setting up the assessment, there's no bilateral stimulation. So we're just talking and setting this up. Phase 4, desensitization, is where we're going to be adding the bilateral stimulation. And we're going to look at what desensitization looks like in a minute. I am going to switch over to a clip for you guys because we're going to be watching this demonstration of where we're going to see how we're going to set this up. So let me get to the
being age 6,
and then I'll share this.
know how it's going to change. Okay. So go ahead.
Okay, so about 2. So I want you guys to just, and hopefully you can see this, maybe you can't. let me pull this back up. I think I'm going to show this one first. So I'm just going to show the setup of this. I can here. Sorry, just my technical difficulties. So I'm going to show mine because I want us to see the whole video of the other one that we're going to play. But I want to show you just what this is going to look like to set this up. Really quick.
2 weeks ago,
So this isn't a training I did, obviously a while ago, but just listen for how we're setting this up. So we're going to see what we're targeting.
I went home to visit my family for the first time in years. And I was sitting around the kitchen table with my grandmother and my aunt. And my grandmother started to talk about her childhood trauma. And I'd never heard her talk about this before. And so I was kind of like, yeah, let's hear it. And my aunt reached over the table and started shaking me and yelling in my face that we don't talk about anything that's sad or anything that hurt.
So what feels the worst about that incident when you bring that up?
The worst part is feeling like I am powerless and that I have no choice but to be a victim.
Do you want a list of negative beliefs? When you bring that up, what's kind of the belief that fits best?
Yeah.
Do you want my list?
It's probably...
Normally, this would be a client. This is a clinician that's familiar with them, right? So we'd give that negative cognition list. But she's familiar with those, so she might come up with her own. But I want you to notice, like, viscerally what we see kind of going on. And also, even though it feels somewhat detached, you're going to see the way that we restore attachment when we get into this.
Probably I am powerless or I can't have a voice.
And so her worst part, right, was that I have no choice but to be a victim and I'm powerless. Usually you'll hear some kind of relation if it's a worst part that's descriptive like that. The worst part and the negative cognition will sometimes be closely related.
Probably more that I can't have a voice one.
What do you wish you could believe? Like, despite this happening?
That I can trust myself to protect myself, essentially. Like I can be my own protector.
And it doesn't have to be on the list. I know this is something I get asked a lot as well. So like I can be my own protector is obviously not on the positive cognition list. It's just more important that the negative cognition and the positive cognition, the list is just there as a way to help them kind of find the right words. It just needs to be an I am statement. So it's the way that they are internalizing things, the way that they are personalizing things. So that's what we're kind of looking at. So we need to look at how it's being internalized. When you bring this incident up, like back visiting your family and you're at the table and this happens with your grandma and your aunt, what are the emotions that you notice that come up for you now?
An intense fear for sure.
all of these are now looking back. So we're thinking of, as she's thinking back on the incident, what's the way she's internalized it? What would she like to believe that's going to help her kind of get unstuck? And then the emotions are, as we're thinking about this now, the emotions that come up.
Embarrassment and humiliation. And there's some anger there too.
Where do you notice that physically when you bring up those emotions?
Yeah. Already I feel it in my hands, like my hands are shaking. And my right leg is shaking.
Do you notice that anywhere else physically?
Yeah, my throat gets really tight. And my jaw.
Anywhere else?
Yeah, my chest, it's like just a cutting, intense fear.
And so if she would have just said chest, we would have said, okay, what are the actual sensations associated with that? But she did good describing those. What would you rate the intensity of like the emotions and that physical sensation, like of this event when you bring that up now, where 10's like, it still feels awful and unbearable, and 0's like, I can think about it and it doesn't bother me?
Probably a 7 or an 8. I'm with that.
Okay. And this belief, I want to go back to the positive belief for a minute because I didn't rate this, but when you bring this up and, you know, wanting to have that belief that I can be my own protector and I can kind of trust myself, how true does that feel to you right now? Like where 7 is 100%, I believe that.
Probably a 1.
Okay. Are you okay with tapping? Okay.
Oh, on myself or?
No, are you okay if I tap?
Yeah.
Okay. Okay, so this is our assessment phase. So you see, we literally set that up in about 5 minutes. Trying to get out of this. So we set that assessment up in just about 5 minutes, right? So we're not wanting to spend a majority of time there. Sometimes if you get the really talky clients, you kind of just have to like move it along. So sometimes I'll just, as they're talking, I'll be like, what feels like the worst out of that? Like you kind of have to kind of move it along. Once they know how EMDR works, usually they just get in the rhythm of knowing that this is how we set it up, and then we move into where we're going to see we add the desensitization. So that's what that phase 3 looks like, what we call the EMDR protocol. I'm going to do this at every single session when we're getting ready to do kind of trauma processing, when we are ready to start working through some of the traumas. And we're going to kind of just work with one incident at a time. And one of the nice things is that you can start with something current, like I said, like the crisis of the week. And I know because of that adaptive information processing system that the brain is going to take it where it needs to go. The brain has already made a linkage or a connection to why this is causing distress. So I know that even if I start with something current or that feels kind of like surfacey compared to other traumas they faced, sometimes it's still a way that you'll get into being able to go back to where this started. So the brain will naturally go to where it's connected, and that's going to help you continue to kind of like get them to process maybe traumas that otherwise they might be avoidant of, right? So we're going to kind of work with one incident at a time in each session, and then we're going to see what this desensitization phase looks like after we come back from break and after we take some questions. We're going to see this session kind of play out of what that looks like. This one that you're going to see, I'm doing like, I'm going to do actual tapping with her. So you're going to see what that looks like. Later today, I'm going to show you one with the eye movements that I thought I was going to use first, but I want you to see that protocol set up. And the other session's really good because she does some really good prep work before, and I want us to see that whole thing. So we'll see kind of this session. I'll be teaching along as we go. We're going to be talking about what this next phase looks like, where we add the bilateral stimulation, how we do that, what we're watching for, because this is the part that takes a lot of training to be able to understand what you're doing and what you're watching for and how to work with things if big stressors arise. So I'm excited for us to kind of get into the meat of this and see kind of what happens from here in this next phase. So we're going to go ahead and we're going to take our first 15-minute break. So we'll be back a quarter till. When we come back, we'll take some questions. So if you have any questions about anything that's gone on this morning, please feel free to put those, get those sent over to Ryan, and we'll address those. And I look forward to hearing from you guys and seeing you guys shortly. So have a good 15-minute break, and we'll see you when we get back. So welcome back, everyone. Ryan, I thought those questions were all important, so I'm looking forward to going through those with you.
We will get all of them. That we've got a lot, but some of them there's some overlap. You guys have some things you're all kind of thinking some of the same stuff. But before I jump into those, one of the things that keeps popping up in the Q&A is I like learning with Megan. I want more opportunities to learn with Megan. So I don't want to turn this into an infomercial, but what I can tell you is look in the portal that you guys all have access to. Just check that stuff out. There's opportunities in there. And then watch your emails in the days that are coming after the event. More opportunities for you to learn with Megan if you'd like. So just keep an eye out for those. So,
and if there's more specific things that you're wanting or have an interest in learning from me in particular, let Ryan know what those are too. And we'll be happy to. We can the right way.
Megan's great about meeting your needs. So when you guys ask for stuff, we talk about how we best do that. And there's a whole bunch of resources that she gets together in training. So we can definitely do that. She's easy to find online too. So again, if you're feeling like you haven't done that, most of the time you guys do. But feel free to check her out. She's got a website with all kinds of information on it. That's useful for folks as well. But questions that we're going to get through right now, a bunch. The first, though, should we have clients try all the resources kind of one at a time and then let them pick the ones they want to use? Or are you as a therapist kind of making a judgment based on your work with them and how they're responding to things, what you like?
Both. You can usually get a feel, if someone comes in and they're already telling you they don't have a lot of support, then maybe restoration team isn't the place that you start. Maybe it's Complace. I don't like to do them back to back to back. I know we did Complace and Container back to back yesterday, more so that you guys could just get a feel of what those skills are and have those tools. But I might do one of those a session. So maybe in those early first 2 to 3, 4 weeks together, maybe I'm teaching one of those each week and then practicing those, using those as we move forward.
And then there were some iterations a few times, but do you use BLS with all of the resourcing techniques, or is there a time where you would not use BLS before you get to phase 3?
Yeah, so this is honestly probably more clinical preference, because I know there's a lot of EMDR clinicians that maybe vary. So for example, I have a preference. I like to use the bilateral stimulation to enhance. So I use it as a way to enhance the positive sensations, to immerse them in the experience, especially if I know that it's someone that struggles with attention, concentration. I found that it can really help that way. There's some people that don't like it for resourcing and they're able to do meditation. If they're able to just sit and do that, again, that's client preference. And clinician preference. So do what kind of feels right for you and right for the client. I just have a personal preference. I just like it because of that dual awareness that it provides.
Might be a similar answer for this, but Complace, does the client have a choice between tapping or the eye movements, or do you recommend the tapping? Doesn't matter.
Yeah, you can do, I recommend whatever works for them. So I was doing a training in Italy in July in person, and Italians only want to use eye movements. So it's really funny. So they're like anti-tapping, anti-sound, and they just want to use eye movements. And so, if that's the client preference or your like clinical preference, yeah, you have eyes open and they're doing calm place while they're like doing that with the eye movements as the bilateral stimulation. Um, Again, I think it's just the preference of what the client likes, but eyes open or closed is fine with that too, even if you are doing the tapping.
And we've got we've got a mix of people who are new to EMDR and people who have trained in EMDR long ago and are refreshing. So there's a couple from folks who've been using EMDR and maybe having some issues that they'd like to weigh in on. But the first, trained in EMDR, always found it challenging to treat nightmares. And they just want you to kind of dwell on that a little bit. What happens with that if that's not something you're talking about later, but that's an issue they're having?
No, I think this is a great one. And honestly, it's something that comes up a lot, especially with trauma and PTSD. We know that nightmares and those kind of things can kind of occur. There's some, like one of the things that I like to do and is have them practice like calm place right before bed, or even like playing out. There's actually a nightmare and dream protocol that you can use when you get kind of further trained in EMDR. And what they essentially have you do is you can lay in bed. You can do it a couple ways. You add your tapping and you think about the dreams that you want to have, like that are positive, and you kind of like tap them in. Or if they have nightmares, you have them do like a session on the nightmare where maybe we target it, or you have them write out what they wanted the ending to be or what that would be like. I like having a container for bad dreams. So just a bad dream container. This is something that I actually learned from Ariel Schwartz, where she talks about have them have these containers that are specific for dreams and nighttime, where if they wake up with a bad dream, they can go to imagining putting it in the dream container.
This one might overlap a bit, but someone else uses EMDR clients often have increasing emotions outside of the session, and again, not nightmare, but really vivid dreams.
Yeah.
And again, wanting to know your experience and how you work with that.
That's really common, and think that's really part of that natural processing system that occurs. So vivid dreams are very common after an EMDR session. Maybe that happens for a couple nights. That's the brain's way of kind of integrating this new information that it's taken in. So I just let them know ahead of time what to expect. Again, right, as trauma survivors, we just want to know what to expect. So if you give them a heads up, they're like, okay, I was told this happened. It creates less distress. Also, what you're going to see, and you'll see this kind of play out differently, you'll either find that clients are like more emotionally like drained and kind of just like wiped out after a session, or maybe they're going to be a little bit more emotional or like sensitive to those emotions, but not to a point of like dysregulation, just like we've kind of opened that up a little bit and they're still kind of filtering through that. That's also normal. And again, if you just prepare them, let them know that usually after a night's sleep or 2 nights sleep, that gets better. Use those resourcing skills if they need to. Completely normal.
Then a number of questions on some of the specific exercises. So trail exercise. This individual found themselves alone each time. It was stressful. They didn't want to be alone. Where do you go from there when the trail isn't providing the safety that you were hoping for, trying to create?
Yeah, so I would bring in, like, let's imagine bringing in that restoration team this time and see what happens. Or who would you want there that you're having a hard time pulling in? Even if you're not sure, I go back to that restoration team a lot. If that is a challenge, because usually I do this one, this would be an exercise that's done after we've already done calm place, container. This is really leading up to kind of getting into the trauma work, or maybe even yourself as the therapist. You and I'm your kind of co-pilot here. Can we be on this trail together? What are we going to figure out together? Those things can work quite well for that. And maybe it's going back to some of those resources, and like I would want like that restoration team or those additional resources done so you can pull from those when you run into these kind of blocks.
And then a couple about people who struggle to visualize things again. So kind of what goes on if a client is getting stuck in the complex activity, can't visualize moving through the path, they stay in one spot on the path.
Yeah, I like eyes open for that, and I really like to use visual aids and prompts. So maybe it's like you pull up a picture of, again, like your ideal calm place, the place you've been, and your eyes are open while I describe it. And usually with the visual additive, I found that they're able to kind of like see that at least a little bit more, describe it. Also, it doesn't even have to be visual. Your processing doesn't have to be visual. Some people might just hear words, or they might just say, like, all I thought about this time was connected, or I'll have a lot of clients that say, I just saw like 3 particular words and nothing else. Or it can be really abstract, like, now I'm feeling that in my chest, or it's moved down into my belly. But those visual aids can be huge. So even with like the path, like pulling up an image of a path, where would you want to go next? And having eyes open while they add bilateral stimulation while they're looking at those visual aids can usually help alleviate a lot of that.
And here's someone asking, so when you ask what emotions come up, do you ever give them a list to go through identifying emotions ahead of time for people who lack the vocabulary to express, aren't very expressive with those kind of words? Do you give them something ahead of time, like here's a helper?
Yeah, some in that early like preparation and like history taking phases. I mean, you're going to do kind of those normal like therapeutic interventions, right? Like, so maybe we've learned about attachment styles. Maybe we've talked about like I like the like feelings and emotions wheel, where it shows like what they lead back to. So I might have done something like that. I have one in my office that's out displayed that sometimes I just will give to them, or they can look at and identify. But I really like, honestly, with the emotions, I like their description of it, because again, it goes back to that interpretation of how they see it. And a lot of us maybe haven't had as much knowledge on emotions, but it's still important to see, because what you usually find is they'll be like, oh, I listed it as fear and sadness. And then you get into processing and they're like, wow, I didn't realize how much resentment was there, or how much grief was there. And so they'll kind of naturally get to those things. If you do feel like they lack that, that's something that I'd spend more time kind of developing in that phase 1 and phase 2.
And here's someone again just kind of looking at bilateral stimulation. You get to this point where you're starting to incorporate that. Do you mention that, ahead of time? Are you discussing with them, BLS stuff at the get-go, so they know kind of?
Yeah, and if you remember back to, you educate on what the bilateral stimulation is in phase 2. So before you've gotten here, they better know what bilateral stimulation is. And you should have probably at least introduced that to those resourcing activities. And those should be done before you get to this phase. So we're never doing this without that prior psychoeducation prior.
And there were a couple of different questions when you showed the video of kind of you in action. They noted that you were taking a lot of notes. You looked like you were writing a lot of things down. And so there's a variety of questions like, what are you writing down? Are you explaining to clients what you're writing down? Are they okay with the fact that you're writing a lot down? I'm curious as to what was going on.
Yeah, great question, honestly. And I'm glad you guys asked this, because this is one that I probably need to elaborate on a little bit more. And I actually get asked this quite a bit. So I actually like to take notes of each of those things, and I do it right in front of them. I let them know I'm just writing like verbatim kind of what you give to me. And then what I do is I actually keep I have an EMDR binder that I use with each client. So this isn't something that goes into their chart. I put their list of resources in there, so they each kind of have a tab. And then I put all their protocols in there, so I know what we're targeting, and I say, this is to help us. So if we get stuck, we can come back and we can look at themes of other things that we've targeted. And so I like to write those things down. And honestly, I've pulled those out so many times with clients where it's I feel like this was related to a protocol or an incident that we targeted before. And we might go back to those. and look through those like together where we're kind of seeing that. And honestly, I feel like clients see it as like you're really invested in the process that's taking place, and that you really are like trying to help them like navigate through this, that you've invested enough that you're not just there, but it's like we're kind of problem solving together. We're both being investigators about how everything's been related on their journey to healing.
And the last two for now, memory related stuff. So maybe we'll combo them together. But every time you have to reprocess the same memory more than once, and how do we get to the touchstone memory? Or does that show up naturally, as we're processing stress?
Yeah, so let me take that first one first. So reprocessing the same one, honestly, that will occur. There might be like 5 triggers related to the same memory, or there might have been like 3 or 4 negative cognitions that formed just from this one event. So yes, sometimes you'll have to revisit the same memory that you worked with or the same incident, but usually they look different. So it's around different parts of it. That's very common. And then in phase 3, if you want to get to that touchstone memory, I mean, there's a couple ways you can do this. I like I call it that side door approach, where we can just start where it is. And I know that once I get into there, I know how to bridge it back to something earlier, which we'll talk about to get to that touchstone memory. There's other ways where it can be like, we might have set up this protocol like we just saw in this demonstration. And then before I even get into that, I might say, okay, when was the first time you remember feeling like, I want you to close your eyes, go back in time. When was the first time you remember feeling like you're always going to have to be a victim, or you couldn't talk about things? And then maybe we set up a whole new protocol, and that would be the touchstone. I like to naturally get there in processing, because I feel like you find what it's truly related to when you naturally sift through it in their processing, which we'll look at how we're going to do that. And it will always go there with current distress. And you become a believer in that when you've had your own EMDR experience, because you're like, I didn't want it to go there, and it went there. So that will happen. But I find that you find a more accurate representation of that touchstone event if you naturally kind of let that process occur.
Perfect. That's it for questions for now. Keep them coming, folks, and I'll jump back on the next time we do some Q&A.
All right, thanks, Ryan. I did add some more of those resources for you guys to the additional resource list over the break. So I've gotten pretty much everything added on there that we've talked about in terms of just links and other things that you might be needing. I will add the path exercise and that tuning in exercise for you later today. But hopefully that will be helpful, just to have those other resources that you can go to, or links for those things. I even put that those extra childhood, the video I talked about with additional childhood triggers on there. If you guys get time, check that out. It's a really great channel as well. He does some really good things with those, tying back like childhood trauma triggers to how they're presenting present day, that I like. So we saw that protocol set up, and yes, you will see me write a lot. I like to take notes of what comes up. It helps me kind of track themes. I'm always doing that right in front of them, so they see what I'm writing. Most of my clients just become kind of attuned to that. Sometimes I'll write just like those significant patterns, especially if they give you a lot. I will maybe just make notes of summaries of the themes that I'm kind of hearing. And usually we'll kind of go back through that like at the next session of like, and I'll pull that out. Here's what I thought was interesting. Here's what I saw you process. I try to be really transparent with that process as I'm taking notes. I found, and this is just my own way that I like to do this, I guess, as a clinician, an EMDR clinician, I found that it helps me really see like maybe some of those other touchstone memories that we might need to come back to, because there's so much that gets processed within EMDR that it's important for us to kind of really like learn how to cue into what are some of those themes, because you'll see all kinds of stuff comes up, right? Which we're going to see here in just a minute. So let's talk about this desensitization phase. Before we watch this demo. And I'm going to pull up a document. We're going to talk about what we're going to do here. What we're watching for. So the next phase that we're going to get into, this phase 4, the desensitization. And the desensitization is ultimately where we're reprocessing things, we're desensitizing the triggers, is really where we're going to spend a majority of our session, our processing session. So let me show you a couple different things that we can look at to describe this. So on our protocol sheet, we said, you know, here's what we're kind of targeting. I'm going to use that and come back to that. And then we're going to look at just this next phase. So this is phase 4, desensitization. So this is where we're adding the bilateral stimulation. So I'm saying, you know, what kind of bilateral stimulation would you like to utilize today? They've already been practicing this with some of those resourcing activities, or they've at least been introduced to it. And then I'm going to just kind of summarize what we targeted. So we're going to bring up this initial incident. We're going to bring up the worst part. Like I kind of just like restate it back to them. And I say, I just want you, I'm going to, you know, just bring this all up. Let your mind go wherever it needs to go. There's no right or wrong way to do this. No right or wrong thing to think about. Just let whatever comes up, come up. I'll pause you at certain times and we'll check in and we'll see how you're doing. I'm just going to be checking to make sure that it's progressing, which we're going to look at in a minute. I'll clarify what I mean by that. But basically what we're going to do, and kind of when we're starting, and you're going to see this will look a little different in both demos, but it's good for you to see the flexibility that actually is like available and possible within EMDR. So kind of the rule of thumb to start as you get kind of like when you actually go through the EMDR training, they kind of tell you when you start the desensitization, you know, let them have about, they call it 24 sets. So this would be 1, 2, right? A cadence would be 1 set. So about 24 of those would be what they call a set. I liken that to about 30 seconds. So I tell people kind of just let them process for about 30 seconds. Now this is specific to adults. Kids you have to do less with. They cannot tolerate that long. They don't have the attention span. So it could be anywhere from 5 to 20 seconds. But we don't usually ever do longer than about 30 seconds, depending on the age and the child's ability with that. So you shorten it down with kids. Adults were right around, and teenagers that can handle it, right around 30 seconds. Depending now, some of the time what will occur is people need a longer period of time to process in sets. So because I use EMDR all the time, I've kind of learned what to watch for that kind of tells me how they process. And usually the more you work with someone in EMDR, you kind of learn the way they process. So some people need like, they just want 30 seconds, they're done. Some need like 45 seconds. You're going to see kind of that variable. I'm watching for the body language during this time. So when we add the bilateral stimulation, I'm just watching for the somatic responses. That's telling me that there's things activated. So I'm looking for those deep swallows, the tightening muscles in the face, or any of those shifts or emotions. That's all telling me that there's some type of activation and processing occurring. So we're going to add that bilateral stimulation for roughly 30 seconds. It will be completely silent. So again, this part's important. The client's just thinking about what is coming up. They're not talking about it. So they're just thinking and processing. And I say it will just be totally silent, and let yourself just think about it. And I explain when we verbalize it, it actually slows the processing down. And so I want it to just be silent. It'll be totally silent that 30 seconds. They're just thinking on things. I'll pause after that. I'll check in if the duration was good enough for them. And then I'll say, what are you noticing now? That's a common kind of phrase. What are you noticing? What are you getting now? What's coming up? They'll share that with me. And then when you're first, again, learning this, you just continue to say, okay, let's just go with that. and you allow them to kind of continue to sift through that. And we just continue with this over and over. So we do 30 seconds check in, 30 seconds check in, and you're going to do this for the majority of the session. This is the biggest chunk of the session that you sit in. And we're watching for some things. And so this is what we're going to be watching for. So these are, I made this kind of tip sheet for what I look for in the desensitization phase. And I call these kind of these mile markers. So I'm looking for, when I check in as the clinician, I'm just looking for any change in thoughts, perceptions, images, or whatever. So when I check in, I'm just here looking for or listening for any type of change. Doesn't have to be positive, but I just want to see that there's thought progression of some kind of, to some degree, taking place. So when you practice EMDR, you get to learn that what we don't want, or what will happen a lot that we need to be aware of and why we check in, is sometimes we'll run into what we call blocked processing. So it's like all I saw this time was blackness and I got nothing. Okay, let's explore that further. You add the bilateral stimulation for another 30 seconds, you check in, same thing. All I saw was blackness and I was getting nothing. So when we hear the same thing repeated without any change, that means that there's a block in processing and we have to do something to kind of assist them or to jumpstart that. And that's where we'll talk about how we use kind of some of these open-ended nudges or questions. So we're looking for there to be a continuation and change. And then we're looking for what we call an abreaction. And an abreaction is a strong emotional response or shift. This is normal, and you have to be prepared for this as a clinician. EMDR can elicit a lot of emotions. So abreactions are part of the process. It's where we see a peak in emotional kind of, they're anxious and upset, but there's still thought progression going on. Essentially, they're being allowed to grieve and feel what they've repressed. And you let this happen. So oftentimes, like, we get anxious and we want to shut that down. I might check in, you okay? You're doing great. We're good to keep going. And abreactions, I let them know before time too, that there will be a strong emotional response at some point. That's normal. And I want you to know that it only lasts like about 5 minutes at the 5-10 minutes, worst case scenario, 5 minutes at the longest. So it will peak and it will come down. That is part of the process. That's also part of how we get the desensitization to start to occur. So emotions will come up. You have to learn as the clinician to sit with those and to trust the process and allow the client to grieve those and to work through them. Because when we shut that down, so when we're like, I don't know, they got really emotional, so I took them back to ComPlace, maybe we need to do that. But if we continue to do that and it's with a client that is resourced, what are we communicating? So eventually we communicate kind of intrinsically, right, that those emotions are even too big for us, and us as the therapist, if we're having them regulate those and put them away, then they're going to maybe continue to internalize that those emotions or feelings are too much for them. So be mindful of that. The abreaction piece is very normal. Give them permission to feel that and trust the process, because it will turn. Then I look for what we call this tides are turning. So this is where we see kind of maybe there's thought progression. It kind of starts like maybe heavier, negative. We have a peak in emotions, and then we see the peak start to dissipate, and we're seeing them have this change where they start to identify either more options, more positive thoughts, more realizations. So that's the tides are turning. And then we're looking for these continual kind of like gradual, like new insights, new options. They're kind of resolving it on their own, essentially. Or we hear a sense of safety, control, or choice. And then once we continue to hear them stay very positive after these other things have occurred, if that stays positive for about, anywhere from 3 to 5 kind of sets, then I'm going to check back in. And I'm not checking in before this, so keep this in mind. I rarely will check in. I won't check in until probably the very close to the end of the session. So then I'm going to check back in and I'm going to say, okay, that positive belief of, with my client example, where she said she wanted to believe that she's significant and important. You rated that as a 2. As you bring up being significant and important, how true is that feeling to you right now? And we're wanting that to get as close to a 7 as possible.